republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. We will open up our meeting, and thank you for being here today. The first item we're going to celebrate is that in our presence in this room is the new president of the Florida League of Cities. Any comments about your weekend, sir?
Well, thank you, Mr. Mayor, and thank you to all who I call my City Laker family, and all those that may have been part of the actual Florida League of Cities annual conference this past week. I certainly appreciate all the support that's been given by my city family and those who came over. Mr. Mayor, thank you for that, and Mr. City Manager and Assistant City Manager, and others who may have been, of course, Commissioner Madden, who was our delegate, and others of you who I know had sent out your thank yous and to me. I appreciate that. It is well said by the prayer that was just said by the minister. Thank you for that. We live in a very diverse country now, and I think from what you may hear from Commissioner Madden, I'm sure she will tell you how some of the statistics that were shared with us about how Florida is changing and changing rapidly. And I won't take away from what she may have to say. She's a delegate and would say what she needs to say, but certainly I appreciate, again, the confidence you all have in me to be able to lead this premier organization. You know, well over 2,200, elected officials that are members of the organization, 411 cities throughout the state of Florida, and we're doing what we need to do to make sure that we can protect local decision-making authority. I think it's important that we share that, because I know, as we've seen even through what we're dealing with the COVID situation and even other things, that the state organization, our governor, what he's doing to keep, I'll call commerce and business flowing as fluid as we can with what we're having to deal with, in this health crisis. But certainly we know that as he doesn't want, I call it the federal government saying what need to be done, what's best for Florida. What we say the same thing about our cities, because one size does not fit all. And I think it's important to know that. We work together, we play in the sand together, and that's what needs to be done. So again, thank you, Mr. Mayor, for this time. Thank you to my Lakeland family. I appreciate you all and your and tag teaming to help me out, especially sorting through this next year as we travel throughout the state of Florida. Thank you so much.
Thank you, sir, and we're very, very proud to be able to serve alongside you. We're going to have two presentations this morning. The first is going to be a report from the local officials, and Dr. Joy Jackson is here to do that in person first, and then by GoToMeeting we will have Daniel Drummond from the hospital, the CEO of the hospital, join us as well, and she's going to make some comments and be available for questions and answers too. Dr. Jackson, thank you for coming.
Thank you very much. Good morning, everyone. And I appreciate the opportunity to speak before you today and give you an update on where we are with COVID-19. To say that the past 16 months have been a whirlwind and a roller coaster is putting it mildly. I will just reinforce that we learn about this disease every single day. I spend quite a bit of time every day reading sort of the latest research, what is coming out. Everybody digests it, and there's lots of opinions across the world about what is going on. My main takeaway with that is that COVID-19 is not going to adjust to us. We have to adjust to it. And please, stay current, stay responsive to what we need to do locally to protect ourselves as individuals, and that will lead to what improves the health of our community. So this first graph shows you the trajectory of cases since the middle of June. To remind you, we had two previous spikes in cases in Polk. The first was after the July 4th holiday last year. We had another spike around the holidays, Christmas, New Year holidays this year, and then this is the current increased trend, which is significantly higher than what we had in January. This is likely a result of Delta variant. We know that over 90% of cases in this area are likely Delta variant. And you might say, how do you know that? Well, a certain percentage of specimens are analyzed by CDC. There's no way to do genomic sequencing of every positive specimen, but they do a representative sample just to give us an idea of what's going on locally. But the size of this spike and the rapidity, the speed by which it developed, let me know that this is likely Delta variant. You saw that our case numbers doubled week to week, which is a steeper trajectory than what we had in January. Last week in Polk County, we had about 6,500 cases recognized. Our highest peak in January had been 3,800 cases in a week. What I'm a little bit hopeful for, the difference between the week before last and last week is a little bit smaller than before. So I'm hoping that we may start to see the top of this, but it's too soon to tell, and school's just started. So we have to see what role that plays. You may say, how many tests are being done on Polk County residents? Last week, in the last 7 days, over 25,000 tests were reported for Polk County residents. Were they all performed in Polk? No. My report says how many people in Polk who live in Polk got tested, over 25,000. A year ago when I was in front of you, there was a problem because there wasn't enough testing. The testing was slow. I would tell you right now, there were dozens of places across the county to get testing, and results come quickly. We've got rapid antigen tests and PCR tests, so that's the good news, is that most people can get testing if they need it. Our test positivity last week was around 26%. Our desire is that test positivity is under 10%. So our community metrics that show how bad it is puts us in a high transmission category. CDC defines high transmission as 100 or more cases per 100,000 people over the course of a week. Polk last week was over 900. So if you want to say we're a hot spot, the answer, I hope I can convince you, is absolutely yes. So let's talk about what we're doing about this as individuals and as the community, and that's vaccination. The most important thing we can do to protect ourselves. To remind everyone, Polk population is just over 719,000. Of our residents, over 350,000 have received at least one dose, which is 49%. Of our population that is age eligible, which is 12 plus, 57% are vaccinated. Of our school age adolescents and, that are eligible, 33%. So when we look at our middle and high schools, a third of the students are vaccinated. Our most highly vaccinated are 65 pluses at 84%. They were the ones, as you know, that were chosen first to get the vaccines. Huge response the end of December, beginning of January, when they were the first line. So kudos to them. And I will tell you that that has been highly successful. When we look at hospitalizations and deaths, the percentage of people that are over 65 are far less than they were a year ago. So that's a testament to how useful and helpful vaccinations are. They now represent around 10% of our hospitalizations. Deaths across the state have had an upward tick. As I've said before, once there is an increased number of cases, it takes 2 to 4 weeks to start seeing an increased number of deaths. You got to think about it. You got to contract the virus. You got to get diagnosed. Generally, hospitalizations occur 7 to 10 days after onset. Then if somebody has demise, then it has to be reported. There is usually a lag of 2 to 4 weeks after diagnosis before we start seeing deaths. So across the state last week, there were over 500 deaths. I will tell you that Polk is starting to see a bump up in deaths. Our median age for deaths is in the mid-60s compared to a year ago when it was over 70. Again, a testament to what vaccination does. So the progress of vaccination, I am pleased that our number of residents being vaccinated weekly did have an increase with this spike. I will say in June, when we thought we were sitting pretty, we thought COVID was in our rearview mirror. You know, we were vaccinating a reasonable number, probably 2,500 to 3,500 a week. Once it became apparent that we were having an increased number of cases, it did get the attention of some people. And you will see that over the past couple of weeks, over 10,000 a week have sought their first dose. This graph shows first doses. To me, that is somebody that's decided, hey, it's time for me, and that is quite all right. Early on, we had early adopters, we had older people, we had people that wanted it and, you know, wanted it badly. Then things slacked off as far as interest in vaccination, so we are seeing a bit of an uptick. I would still like to see another couple 100,000 in Polk get vaccinated. So we're nowhere near the end. There are lots of places in Polk to get vaccinated. Every vaccine should be free. If your insurance gets billed, it should be only for the administration fee. The vaccine itself is free to all. And it's readily available. And you can go to floridahealth.gov, and there's a link. You can find the county or the city to find vaccination sites. The health department is certainly doing vaccinating. Lakeland Regional, all of our larger medical practices, many pharmacies, vaccination and testing are readily available. So that's the end of my slides. I'm happy. Oh, you all may be aware that the FDA has authorized we're not calling it a booster, it's a third dose to sort of augment the primary vaccination series for individuals who are immunocompromised. So what happened, the FDA authorized that toward the end of last week. The ACIP recommended it on Friday, and that's now going before the CDC to come out with a final recommendation. And so it is recommended that certain people receive a third dose as their primary vaccination series to people who are immunocompromised. The short list of this should be people that are undergoing cancer treatment now or in the recent past, HIV people who are not, that are more end-stage HIV or not well controlled, transplant patients, people who have primary immunocompromise, and then the big caveat is people that have certain underlying conditions that may make them at risk, and people who are on immunosuppressive drugs. So I imagine we will have a big interest in that third dose before long, but I don't have details as to what that guidance is going to look like and when that will happen. But if I were to guess, it's going to be in the next few days, or even the next few hours, who knows? So I'm happy to try to answer any questions from any of the commissioners or the public, however you wish to do it.
Commissioner Walker.
Thank you, Mr. Mayor. Thank you, Dr. Jackson. Thank you for always, being, I guess as transparent as you can to share with those of us here in our community, but also the county as to where we are and what's going on. Well, I've come to believe, and it's only Philip's opinion, and as I share and as I read and as I understand some other things that I align my life according to, this is something we're going to live with. And my take is, from you as a professional in that particular arena of which I have no knowledge in the sense of, but Mayor, of course, hearing what you're saying, how best, do we kind of counteract outside of maybe, as you said, vaccinations, to live with something that we know is going to be part of what, our lives will be like for this point forward. After hearing some things, even at the conference that we attended, and some things that we heard from a situation and such, that from the root cause maybe of how this all began and what was purposed behind that root cause, and seeing again that we're going to live with this kind of situation. And I don't like to go there sometimes, but I will. God's word tells me disease and pestilence is we're going to live with in this age. So how do we best counteract outside, again, vaccinations, as you said? What other things maybe could be done?
And I think that's an excellent question. And nobody really knows what's going to happen with this infection over the next few years, If you go back and look at the 1918 flu epidemic, that lasted about 3 years. I have no idea if COVID's going to do the same thing. Nobody really knows yet. And every day is really an education. And it can be quickly overwhelming to figure out, should I go on vacation next summer? I would really encourage us for our own mental well-being to sort of live with the now and listen and learn and protect yourselves. I wear my mask. I've got 2 vulnerable people, as I've said before, in my household. I'm back to wearing a KN95 because I want extra protection. I don't have any words of wisdom other than stay up with the local science and not get overwhelmed with it and just do what you can do as an individual to protect yourself now and this week.
Thank you.
Yes, sir.
Commissioner McCarley.
That was good anticipation, Mayor. Thank you. Dr. Jackson, thank you again for being here. Can you correlate for the public maybe what I've been saying when I've been asked about this with the vaccine? My family and I are vaccinated, and we're early on because we have a vulnerable member in our family and we wanted to be cautious. And anyway, would you compare this to maybe the flu shot? Because what it sounds like to me is flu is something we've lived with now for a long, long time. People opt not to get the flu shot, but we do know that the flu shot makes your flu symptoms lesser. It might not protect you completely against the different strains that we have, but it does give you a leg up as far as how bad your flu might be. Is it similar to that? Is what we're talking about with COVID vaccine? Is that similar, or is there a correlation?
There is. I mean, there's certainly some, when you compare influenza with coronavirus, there's certainly similarities. They're both viruses, they're both respiratory, they're both contagious. But what I'll tell you is COVID is probably more than 10 times more contagious than flu. And the case fatality rate, people who contract it, the risk of death is at least 10 times higher than flu. So I will tell you it is a more severe disease. So similarly, it's a virus. Symptoms can be similar, although things like loss of taste and smell seems to be more characteristic of coronavirus. But as far as the risk to an individual's health and well-being is much more so for coronavirus. On one hand, influenza is likely causes more fatality in youth, in children, whereas coronavirus is more in older people, but certainly children can transmit the disease. So there's a lot of comparison and contrasting. But thank you for bringing up the flu, and I would encourage people to seek out flu vaccine this year because the symptoms can be very similar. There is no ability of a flu vaccine to protect you against coronavirus or the COVID vaccine to protect you against the flu, but heaven forbid you don't want to be in that quandary, which one do I have? And I think that puts a greater strain on our healthcare system. Last year's flu numbers were almost nil, and it's probably because we were all wearing these. So if we all wear these, that protects us not only from coronavirus, but flu. But I am concerned with all of our kids being back in school that we could potentially see more flu. I'm sorry I rambled. Did I answer your question?
No, I think that was great. Thank you so much.
Commissioner McLeod.
Thank you, Mayor. Thank you, Dr. Jackson, for being here and just giving us an update. And on vaccines and the chart you showed with the 20 to 49 age group at 43%, are you seeing a significant increase as of lately in that age group? Or I know that's one of the lower ones. Just curious, are you seeing progress, in recent weeks among younger people?
We are seeing progress. About a month ago, they were only about a third vaccinated. So definitely some progress. And I want to express appreciation of that age group. We also know that that is the age group now that is more likely to be hospitalized. This is the working age group, so they're the ones that are generally out in the community. So this is absolutely an age group that we want to be vaccinated to protect their coworkers, their families, their children, and to protect themselves. But they definitely are stepping up to the plate, and thank them for doing that.
Thank you.
Commissioner Reed.
Thank you, Dr. Jackson. I appreciate you being here. It's great to get these comprehensive and up-to-date numbers. You hear so many different things every day. I have a question. We had a meeting at the Civic Center, 9 months ago maybe, when I believe you were in front of us. And I asked one of the doctors the protocol for when you go and you've been tested positive and they say, go home till you gets worse. I asked my neighbors, had the same situation. They went there and said, you go home, you've been tested positive, go home. As a protocol changed, they just said, go home, wait till it gets worse. And they were upset about that. So they went to Tampa and got somebody said,
Yeah.
take vitamin D3, tons of it, vitamin C. At the place they went in Lakeland, they got absolutely just go home and wait till it gets worse.
You know, and that sort of depends. Most people who get COVID recover well. We do have, and I'm assuming Ms. Drummond will speak to this, for individuals that are at high risk of complications from COVID, based on age, underlying conditions, we absolutely have access in this county to Regeneron monoclonal antibody. And I'm assuming that Ms. Drummond will speak to that. And these are folks that are not sick enough to be hospitalized, but we know are at risk, and they can receive outpatient treatment. So that, I think, is definitely available, and again, I'm hoping that Ms. Drummond will speak to that.
You've got the microphone now. Can you tell our general public what they might do to present themselves today on protocol that they can take care of themselves to give them immunity enhancement?
Yes, sir. So if someone is, relatively young, doesn't have significant risk factors, it is advised to go home, stay home. Any housemates with you should isolate from you in the house. Drink plenty of fluid, take Tylenol, monitor your symptoms, the warning signs for when you should seek emergency care. Chest pain, increasing shortness of breath. Somebody says, cyanosis, change in mental status. Those are the sorts of things that should take you to the emergency room. If you have relatively mild disease, if it feels like a cold or allergies, please stay home. You will hear from Ms. Drummond that our emergency rooms are absolutely full. And we need to keep those that can be handled either by discussing with their private provider or an urgent care, or can stay home where they can take care of themselves. But short of monoclonal antibody for those who are at increased risk, it really is supportive care. Drink plenty of fluids, take Tylenol. There are theories out there about vitamin D, about zinc, about other supplements. I don't know that anything has been proven for those. I'm not going to tell somebody not to do it. Just don't overdose on them or take too much. Be safe about it. But I cannot tell you with all definitiveness that those are cures, or they're not a cure, but if they will alleviate your symptoms.
So you don't necessarily recommend D3 or zinc, stuff like that?
I don't recommend it. I would suggest people do their own research and discuss it with their healthcare provider. When you look at the CDC website, there are things that are there that have been proposed, but they've not been studied to show that there's a definite advantage to them. I'm not saying there isn't, I just don't know. Yes, sir.
I think this would be a good breaking point to allow Danielle Drummond to come in, who can also field some of the questions with further answers as part of her responses if she would like. And then we'll also go back to questions at the end of your comments as well. Danielle, thank you so much for joining us.
Absolutely. Thank you so much for having me. Can you hear me okay?
Yes, ma'am.
Okay, very good. Well, good morning. Again, thank you for the opportunity to address the City Commission, and thanks to Dr. Jackson for providing some context and backdrop for the situation that we're seeing at the county level. I think certainly, while we are encouraged by some of what we're seeing, we also remain concerned with the high volumes of new cases that we're seeing out in the community, and then the resulting hospitalization and demands on the healthcare system at this time. And I'll just start by saying, obviously none of us, wants to get this behind us more than the healthcare community. Our frontline workers have been at this now for almost 18 months. They're exhausted. They've been sacrificing so much. So I just want to start by saying, if you know a healthcare worker, please thank them for all that they've done. We're just so incredibly blessed to have this team that's continuing to be available to care for this community, during this time. It is sad and disappointing to see that at this point in the pandemic, our COVID numbers of patients requiring care right now are 2 to 3 times our previous peak, and that is both in the hospital for inpatient care as well as the emergency department. As Dr. Jackson mentioned, we are just experiencing record high volumes across the board. It is encouraging to see that the number of vaccinations have been increasing as of late. So I just commend those that have gone ahead and gotten the vaccine at this point, and the fact that it is among the younger individuals. And I'll get back to that in a moment, because unfortunately, those are a lot of the age groups that we're currently caring for in our medical center. And I'm also encouraged and very much appreciate some of the modifications that local organizations have made as it relates to meeting formats, postponing large gatherings, as we find ourselves in this time of extremely high spread of the disease. Those efforts will be helpful. And again, I thank those that have made those adjustments, and it's very much appreciated on behalf of the entire healthcare provider community. So I'll start by just sharing some of the statistics that we have at the medical center as of this morning. And again, these are sobering from my perspective, given where we are right now. We have nearly 400 COVID positive patients at our medical center. As I mentioned before, that is more than double where we had been in our past peak, and is approaching 50% of the total capacity in our hospital. Of that patient population, over 50 are in the intensive care unit. 40 are on a ventilator, and over half of those that are on a ventilator are in their 20s, 30s, 40s, and 50s. Some just an excerpt of ages. When I looked at our tracker this morning, we have individuals with COVID that are on a ventilator that are 27, 31, 35, 35, 36, 39, 40, 42. I could go on, but these are young individuals that are very, very sick in our hospital today. As I mentioned, the emergency departments are quite busy. We are ramping up and expanding hours of operation in our drive-through testing center that is still operational, but just seeing the very high demand for testing right now. If you are seeking testing, that is a great option, because it will allow you to get through that process quickly in the comfort of your own vehicle, and avoid having to have visits to other locations for care. If you are seeking treatment, there are options available both in the urgent care setting as well as in the emergency department, but did want to make sure that I shared for those that are seeking testing that option will be available, and will be able to continue to grow and expand the capacity for that service as we move through the days and the weeks ahead. I know we've been getting a lot of questions around children with school back in session, and reading some of the reports that there are concerns that the Delta variant may be affecting children differently, and seeing more prevalence of children with COVID and with COVID symptoms this time around. We have seen significant increases in the number of visits to our pediatric emergency department, as well as our pediatric practices for testing and for COVID symptoms. And we currently have 4 pediatric patients that are hospitalized on our pediatric unit out of an inpatient census of 23. So again, not an insignificant number of children that are hospitalized today for COVID-19. So again, just wanted to be able to share with you, the concerns that we have. As Dr. Jackson noted, there's a delayed effect. So we're anticipating that as we've continued to see these cases increase, that the number of hospitalizations in turn will continue to increase until we can get on the other side of this curve. So again, I just encourage everyone to consider, the vaccine, as well as, their practices out in the community, so that we can all work together to ensure that we can, maintain access for the necessary healthcare services in our community during this very challenging time.
Thank you. Any questions for Mrs. Drummond? Yes, Commissioner Reed.
Thank you. Danielle, you look lovely today. Good morning. I don't know if you hear me or not, but
He has to zoom in on you first. You're just not good.
I heard recently Watson Clinic made an announcement. Are you planning on making it mandatory for your staff at the Lincoln Regional Hospital? Mandating it?
I'm sorry, Commissioner Reed, I'm having a hard time hearing your question.
The question is, are you planning on a mandate for vaccinations for hospital staff?
We have been working to encourage our team to get the vaccine and feel that those efforts have been effective as of late. We have seen a very much of an increase in the number of our team members that have been getting the vaccine over recent weeks. So we'll continue to encourage them and incentivize them to receive the vaccine. And then, of course, we'll continue to evaluate the potential for having that as a requirement in the future, but there's no immediate plans for that. And as you started to ask your question, I also realized I didn't touch upon the one topic that Dr. Jackson had teed up for me with regards to the Regeneron infusion treatment. So we are able to provide that. In fact, we've had significant demands and are currently working to try and redeploy resources as best we can to keep up with that demand for providing that particular therapy after the time of diagnosis. So I think at last count, we were providing 60 plus infusion treatments per day for individuals that are at high risk and have recently been diagnosed with COVID-19. That is something that's administered in the medical center as an outpatient. So that is something that we are providing at Lakeland Regional and are continuing to work through our ability to be able to expand that further, given the significantly high number of cases that we are seeing come through our doors right now.
And would you recommend that for people who consider themselves vulnerable?
Yes. So what typically will happen is at the time of that you receive a positive test, you will be given guidance either from the health system or from your personal physician as to if you would be a good candidate for that therapy.
And how many did you say were in the therapy currently a day? I missed the number.
60.
60.
Mm-hmm. And like I said, we could, I think if we were able to, expand that schedule further, we would do so. Again, for us right now, given the extremely high volume of inpatients that I described and extremely high number of emergency department visits, we're having to, continually work to optimize and balance out the resources we have available to us to be able to meet the significant needs and demands that are coming through our door.
Commissioner Reed.
Thank you. Daniel, thank you for this answer. Again, I have a kind of a personal question. When you're on the ventilator, what's your prognosis? What's your chances of getting off the ventilator before termination?
If you couldn't hear the question, his question is, what, generally speaking, what are the prognosis if you're on the ventilator of survival?
Yeah, I mean, it really depends on the individual. So I don't know if I have an exact number, but I know that, being put on the ventilator is typically, a last step at the end. And it is certainly a very concerning kind of place to find yourself on the overall continuum. I know our team continues to try to work to optimize the care that's provided to those ventilated patients to give them the best chance at recovery. But certainly those that find themselves on a ventilator are in a very, very dire circumstance.
Commissioner McLeod.
Thank you, Mayor. Thank you, Danielle, for joining us today and just all that you and your team are doing, and especially those on the front lines. Can you talk about staffing a little bit and resources, nurses? How are you all doing in weathering, as you approach the capacity levels that you shared?
Yeah, thank you. That's a great question. Of course, we're stretched. These are extraordinarily high volumes. We work to make sure that we're standing ready to be able to care for this community for whatever comes our way. But the sheer volume that's coming to us right now is certainly stretching us. We are working certainly on recruitment, but I would say to you, anytime I'm on calls with other Florida hospital CEOs, it's pretty much the same story that they're sharing, that their resources for staffing are stretched thin. So there's a lot of competition, I'd say, for trying to recruit those individuals, but our team has been doing an exceptional job of being able to bring new providers into our organization. We're providing incentives for our team that's with us today to pick up additional shifts, which again, we're extremely appreciative of, because again, these are demanding jobs. They're physically demanding. And then as you can imagine, having to take care of individuals that are facing such a very dire diagnosis and at such a young age, the mental and emotional toll that this is taking on the care team is also significant. So we're working at the same time to provide more support for the team through our chaplain service and our behavioral health service as they continue through this difficult time. And then we're also working to secure agency staff whenever possible. Again, there is a shortage of agency providers out in the market right now, but we do have additional agency nurses that are joining the organization every day. We've also worked at try and redeploy. As you probably saw, we made an announcement that we are postponing elective surgeries. So some of the resources that would have previously been used for caring for those patients are now being utilized to help us manage some of the COVID surge. So, it's really an hour by hour, day by day effort to ensure that, we're able to accommodate all of the demand that's coming to us right now.
But that is probably one of your most difficult stress points, is it not, in terms of the system?
Absolutely. Yeah, I think that at the end of the day, we always say we're nothing without our people, and it's that care team that is really, who's going to make a difference in caring for the patients and their families coming to us right now. We've gotten very creative from a physical space perspective. So, we are able to, work to care for patients throughout, various areas of our hospital. And again, some of the changes we've made operationally freed up physical real estate to be able to house patients. But we really need to, constantly be working to ensure that we have that staff and the physician providers at the bedside. And certainly that is, the number one priority for us right now is to ensure we do have those resources. As you can imagine, too, at the same time, with this amount of community spread, none of us are totally, exempt from being exposed to COVID or having COVID ourselves, especially as you have, some of the folks that aren't able to be vaccinated, the school-age children's out and about and passing it around. So, the COVID impact then on our resources from a staffing perspective is also a concern right now.
Commissioner Walker.
Thank you, Mr. Mayor, and thank you, Ms. Drummond, for, as you have done in the past, come to share with us, statistics and what's going on here, of course, in our Lakeland community when it comes to a hospital and what you're dealing with there, especially. So, a question for you and both Dr. Just went blank. Dr. Jackson. Wow, Dr. Jackson, about a situation that I heard or got some statistics from this past week at a conference. I was in attendance. And of course, we know when COVID, hit us here some 16 months or so ago, we had those situations where you're underserved, impoverished communities were not being able to get to testing and being tested. But now, since we're now beyond that point, do you see that being a challenge, where those particular communities still not being able to get to a site or get to a place of vaccinations? You just gave statistics about age of those that was in intensive care. Do you see that being heavy among those of those particular communities, such as underserved, or impoverished?
I don't know that I have picked up on the fact that was a notable trend. I think it's been pretty, dispersed and consistent with what we see in our overall patient population with regards to that, those are coming to us, for their care. But I certainly think that it's a continuing area of concern as we work to ensure that there is good access to testing. Again, I think the location of our, drive-through testing should be, convenient, given that we're really, right in the heart of Lakeland, to be able to provide that service, there locally, as well as the vaccine efforts. I think Dr. Jackson and her team did an exceptional job in working to try to, make sure that it was readily available and more taking resources out into those communities. So I certainly am very supportive of ensuring that we are continuing to do that. And, if there's any, role that we can help play in continuing to do that, we are glad to do so. And like I said, we have a lot of resources available on our campus. At this point in time, it is difficult for us to do too much out in the community beyond what's within our four walls as we work to be able to handle the significant volumes that we see right now.
Dr. Jackson?
Yeah, Commissioner Walker, that's a very good question. As you are likely aware, the health department has really worked hard over the past 7 months to try to do a number of outreaches in underserved communities, in African American churches, and that continues. I have a total of 12 vaccination nurses, 12. And those are split on any given day from doing fixed site vaccination, and the other half are doing outreaches. We continually get calls from churches, from businesses, from schools. So my director of nursing has a calendar that she puts all these outreaches on, and she's got a team that she sends out to usually 2 or 3 places every day. Instead of getting 500 people at a time, we may be getting 15 people at a time, but that's 15 people that get vaccinated. Additionally, the health department has ramped up our testing services. We had to move locations in Auburndale, and we're looking at additional no cost to you type testing. So we want to make sure that there's testing available that's no or low cost as well. So you'll be hearing from us through social media and through our connecting with PIOs so the public knows where to go to get a free test. So there are places for free tests, but we want to consolidate that list, expand the list, and communicate it out.
Yes, I think it's so important because hearing some of the information that I heard in the last few days at this conference, and of course the conference encompasses more than just Lakeland. We know it's all the cities and towns and villages throughout the state of Florida, but certainly want to make sure that we're doing our part here in Lakeland to reach out, to be supportive for those particular communities that we know could be, for lack of better words, not able to get to a certain place and they'll be able to pay the cost of a test, all vaccine, whatever. We're doing our part to do that. Now I know, and thank you again, Dr. Jackson, because I know through our senior programs that we have throughout our community here in Lakeland, we've done a very good job, I think, to make sure that the information was getting out, word was getting out, setting up places, like you said, in many of our communities, or the churches, African American churches, or I would say even brown churches that can people can get to those places and get what they need to be tested or have vaccinations taken care of as well. Thank you to both of you for doing that, but I know we need to continue to make sure we do what we can to keep that effort going. So thank you so very much.
Yes, sir.
Other questions? Commissioner McCarley.
Just one more comment. Thank you, Dr. Jackson. I know that you're having a site, I think, tomorrow at Lakeland High School at the football stadium to do vaccines. So we really appreciate that. I know from a parental standpoint, that was huge, and I hope the community accesses your services there. One of the highlights I want to bring up that I think, especially from Ms. Drummond and you, Dr. Jackson, is we're continuing to talk about COVID and all the impacts of that as that disease is on its own. What I think we need to remind the public is by having this high census that has COVID patients at the hospital, it limits how the healthcare community can take care of basic needs of the community at large that continue, like twisted ankles and flu and other issues that come into play. So when you look at a census of an emergency department overflowing with COVID cases, then that limits our healthcare staff and to take care of the daily needs of our community at large. Can both or one of you, maybe Danielle, you can talk a little bit more about that. I just think that ripple effect is really important for the public to hear, that you might have a crisis that has nothing to do with COVID and you might have limited healthcare access because of that. So that's one of the, I think, trigger points we need to talk about and emergent needs is when we're seeing so many COVID patients return, how does that impact other issues that happen in our community on a daily basis?
Yeah, absolutely. Thank you, Commissioner McCarley. I appreciate you raising that point. I think with regards to, what we're seeing in the emergency department and across the health system overall, again, we're a large health system. We're, ready to be able to take care of this community, but at the same time, there are, a limit to, what we are able to do at any given time. So yes, when, COVID has really become, half of the patients that we're caring for, those coming to us for other conditions, certainly, could be, potentially in a worse situation that way. I will say, our decision to postpone some of what I would consider elective procedures, was to ensure that we could maintain access and capacity for those coming to us for true emergency type situations beyond just COVID. So it's to not only free up resources for the COVID care, but also to make sure that we do have those resources available for the emergent care. But at some point, there's only so much true elective in healthcare, and a lot of what we maybe say we'll postpone or put off, you don't want to do that for too long because there could be, longer term implications to that individual. So again, I think the more that we can work together to try and keep the numbers from being at such an extremely high level, it will allow us to maintain access within our healthcare system for both those emergent and much needed healthcare services that we do provide today. But certainly, that is a concern that we have right now, is just making sure that we can maintain that access for other types of healthcare needs beyond those that are facing a COVID diagnosis right now.
Are there any other comments or questions by commissioners? Commissioner Madden.
Thank you, Mr. Mayor, and thank you, Danielle and Dr. Jackson. My colleagues have asked most of the questions that I had. I just want to reiterate their gratitude for your service and for what you're going through, and the soberness of this current spread for everyone. Whether you're vaccinated or you currently have COVID, or tomorrow you might have a heart attack, and you're scrambling to figure out how to take care of everyone who comes in those doors, and you're scrambling to make sure that we mitigate this from a healthcare perspective. I am sad that the state of the last year and a half have created such vitriol and a polarization among people to discuss this from a sheerly medical perspective. I have been reaching out, and I went to your press conference, and it was a little disheartening to hear that if we say it, it just will open up another can of worms and cause more viciousness and vitriol, and cause people to be more stubborn about whatever side they're on. I'm sad about that. I'm proud that we are a nonpartisan commission that tries to look at science and look at our individual constituents and try to hear from all the voices and make the best decisions that we can. But I am sorry that we are not in a position to augment what you're doing on the front lines from where we've been in the last year and a half. But if that changes, and if you feel that there are things that we can do to contribute, to help, we want to be here in the past, we've offered the RP Funding Center and different facilities for additional testing. I'm hopeful, like you said, that maybe we're reaching the peak, but we still have to get through the next couple weeks of when those serious illnesses peak, and God forbid the deaths peak. So I'm thrilled that you came today. I wish that there was more we could do. I'm saddened by the state of political affairs, that it is so vitriolic. But I do hope that you see that we are behind you and that we support you, and we are so grateful for all you're doing for our community.
Thank you very much.
Thank you very much for that, Commissioner Madden. It expresses the sentiments of us all, and we are very, very grateful in this difficult time. Dr. Jackson, anything else you want to add?
No, sir. Thank you all very much.
Thank you so much for your presentations this morning. Very, very valuable for us. Thank you for your time.
Thank you.
That suggestion by Commissioner McLeod to have this as our first point of discussion on Friday's meeting was very, very valuable. Thank you, Commissioner McLeod, for doing that. Our Gene Conrad, our executive director of the airport, who thought he had his first presentation this morning and was going to go quickly, got to learn more. And so we thank you for your patience, sir, as well.
Oh, good morning. It's a little sobering to follow all that up, so I will be brief as possible, and I'm sure there'll be questions, and we'll answer all those. But good morning, the commission, the mayor, city manager. Just appreciate the opportunity to be here today. I'm going to talk about all things not Amazon today, because we've talked a lot about that. There's still a lot of discussion that we'll have in the future about that as well, but there's a lot of other things that are going on at the airport and additional development that I want to bring you all up to date on, and then obviously again answer any questions. Where we've been over the last 10 years as far as our aircraft operations out at the airport, this is really a good metric for us to see where we are as far as the activity levels out at the airport. And you can see at the beginning of the slide, on the left-hand slide, back in 2010, we were about 67,000 operations. Right now in 2021, through July, we're at 72,000 operations. So if we average about 10,000 operations for the next 5 months, we will be on par, or actually over where we were back in 2019, or closer to 2018, which was our peak since I've been here. So when you look at our total operations, 2019, we had a drop off because of visas for our foreign flight students. They weren't able to get into the United States, so there was a drop there. And then obviously in 2020, there was a drop with the pandemic, also not having Sun and Fun, which represents anywhere to 6,000 to 7,000 operations during that 6 month or that 6 or 7 day period. But we are on par to have a pretty good year, the second highest most likely over the last 11. So we're on a good trajectory right now. Moving ahead, and I know Commissioner Reed likes our maps, or likes the maps, so I wanted to, I brought up the master plan here just to point out, I want to talk about the northeast corner here. And so, obviously a lot of development has occurred over the last several years out at the airport, but this is our next development area. This is the northeast corner of the airport again. Right here is the terminal building. Station 7 is right here. And what this represents is this is a 100,000 square foot MRO hangar, maintenance, repair, and overhaul. This is another 100,000 square foot hangar here, and another 30,000 square foot hangar in this area just to the south of all of that development. And the reason I wanted to bring this up is, when we developed the initial 50 acres, that Amazon resides on today, that was originally going to be, a component was going to be cargo, a component was going to be MRO, large hangars to do maintenance on these facilities, and also with these larger MRO facilities, the job creation that it brings. So obviously Amazon's going to take up most of that area to the northwest, but this is the northeast corner that we, going through a master plan update, which most of you are part of. This is represents about 65 to 70 acres that we can continue to develop the airport. Now this right here, these 3 developable pieces is probably closer to about 15 to 20 acres of that. We'd have to take out the runway, close it, and build a new parallel. But I just wanted to show you this is our next area of development, and something we're actually working on right now and working with an entity for one of these areas. Don't want to go into a lot of detail, but we are making some strides in a new MRO operator coming here to the airport.
MRO stands for?
Maintenance, repair, and overhaul. Big hangars for larger aircraft to do maintenance on. Also, what this slide represents here is, if we go back for a second, when you look at it, this is the runway, this is 523, so this is the approach end of 23. It's our crosswind runway, it's only 5,000 feet long. So in order to develop this corner and keep the runway open at the same time, we had our consultants, Atkins North America, look at 523. And so we're able to do this development in this corner while we maintain that crosswind operation, so we can still maintain and operate from that runway. We will have to shrink it in one direction. So for example, if you're landing from Morgan Creek, for example, from the southwest on 5, it would be about a 4,500 foot runway for you there. But for takeoff in both directions, it would be 5,000 feet available. So, and we would also change the designation to the runway as a visual only, so there would be no instrument approaches available on the runway. But this is something we can collectively decide as we move forward. We're going to have an airport advisory board meeting on Wednesday as well that we're going to talk about this. But again, we are able to develop this corner and do what I've just represented here and still maintain this runway, and give us the opportunity to get the new parallel in place, which will take about 8 to 10 years to get done. So we're not running out of space. We can still develop and move forward. If additional development projects that we're getting ready to do on the airport, as you all are well aware, Taxiway Echo. This is a project that we've been working on for several years now. This is Taxiway Echo here. This is the KTTW hangar. This is Polk State College, and this is new Taxiway Sierra. So we'll take out this corner or this bend here that takes you up to the approach end of runway 27 here, and then rebuild this. So we're actually getting ready to start. We should have our grant from the FAA, which we'll probably bring to the next meeting. So we can get started here in most likely October, early November to get this project done, because we are always up against the gun with Sun and Fun. So we have to get things constructed pretty fast. Moving into fiscal year 22, now this is Taxiway Papa, and we have actually demoed the area from this area right here all the way back to the approach end of runway 9 here for our Cat 3 ILS, because if you recall, we're moving the glide slope, which is right here in this location, right here in the middle of the existing taxiway, so we had to demo this piece. So that is currently demoed. I'll have a slide for you here in a minute, but wanted to bring this project to your attention. We have designed this, but we are not on schedule with the FAA to receive construction funds until next year, so we wouldn't start construction until September, October of next year. But if there is fallout money, even with the new infrastructure bill. My understanding is there's going to be about $2.5 billion available for general aviation airport. So this is a shovel-ready, on the shelf, ready-to-go project. So if and when the monies come available, we'll be ready to come out of the gate and get this project done and the taxiway rebuilt. And again, I'll have a slide so you can see where we are with that project or the demo. Future FAA projects, just to bring you up to speed about our 5-year plan and where we're going. In fiscal year 23, what you see there, that big yellow truck, we are planning to get a new ARF truck, our Aircraft Rescue and Firefighting Vehicle. We're planning to get a new one. There's an age of about 15 years, so I believe it was purchased in 2007, our initial ARF truck, so it's time to replace it, and that truck will most likely become our backup. We also designed our Taxiway Alpha shoulders project. So if you can see down here, this is Taxiway Alpha. This is the new FBO here. So Taxiway Alpha is down here, shoulders on that piece, on that taxiway, and also the run-up pad here, which will allow aircraft to pull off to the taxiway and wait for their departure clearance. And then in subsequent years, because the Taxiway Alpha shoulder and run-up pad project is roughly about $10 million, working with the FAA, we're going to split that into 2 different construction components because the cost of the total project. So we're on target with the FAA to do that. And then moving forward, we're looking at what we call the shift of Taxiway Delta. So we would design that and then construct in the subsequent year, and that's going to be a rather expensive project as well. And that will be a large project to help us move our existing Taxiway Delta for the future parallel. So just all these projects are in line with our master plan as we move forward. Also, the VOR relocation, so our big bowling pin in the middle of the airfield. We are moving forward. We have completed the siting study on this project, and we're waiting for the costs from the FAA technical operations folks who maintain this piece of equipment that's owned by the FAA. This is really our first piece or our first domino as far as our future parallel runway. So this antenna sits right in the middle of the airfield. You can see the future runway here and its proximity and its closeness. So we are going to move it all the way down here into the middle of what we call the Sun and Fun parking lot. This is Geico's new facility here, but it's going to be right located in a wetland, and also the picture on the right, it represents it's going to be on stilts. So it's going to be built so it's up above what we would to protect the parking lot and future camping areas for Sun and Fun, and something we've discussed in the past. What I've been told is this project's going to be around $3 million. So we have this programmed with the state for assistance to help us get this done, but this is the big first piece for us as we move forward with the future parallel runway. Some additional development that's happening at the airport as well. We've talked about this in the past, but these 2 hangars here, this is our existing terminal, this is the Hilton Garden Inn, this is the Staybridge. These 2 hangars here, Shelter, one of our FBOs out at the airport, that represents 2 20,000 square foot hangars, which they have taken to DRT, and we're hopefully we'll get these out of the ground sometime this year, if not the first of next year, and that construction would start. We're also talking with a group, these 3 buildings here, this is a hangar, this is Lakeland Generator here, and this is telecom in this area. So this corner at Airport Road and Drainfield, we're actually talking to a group about developing another hotel on this site. So additional development here on the airport. So it will really help us redevelop. Some of those hangars are getting quite old and expensive to maintain. Nothing's imminent at this point, but just wanted to bring it to your attention because we are in discussions to do that. And then last but not least on this slide, we are hopeful to get a restaurant back in the terminal. So we just put out an RFP for that. We received 2 responses. And so we're going to go and we're going to review those responses. I believe we received them last week, Wednesday, and review those responses and hopefully get the restaurant back open. So we're excited about that. I get asked that all the time. So we're moving forward. Real quick on the Cat 3 ILS, we are on target to have the ILS flight checked at the end of September. Adam's probably watching this, and hopefully nothing's changed or I didn't misrepresent that, but this has been a huge project for us. What you see here, this is the approach end of Runway 9, and this is what we talked about with Taxiway Papa, so we had demoed this portion. So this will remain demoed and not there will be no taxiway to the end. Aircraft can still come out here at Papa a 2 and take off and head eastbound from the south side of the airport. But again, we'd like to get that put back in place as soon as possible. But you can see all the earthwork here are for the new ALSA for instrument landing, or the lights that lead you into the runway, all the work here. And then there's a shelter for all of those lights that are being built here, the approach lighting system. There's a new shelter here with the generator that's been constructed, which is down here. And then this building up here, this is right at the base of the tower. That's our new airfield lighting vault. So all of the lighting, sir, do you have a question?
Just where the glide scope is going to go.
Oh, the glide slope. So the glide slope sits right here, or right here right now, and it's going to move right here into the old taxiway popper right in the middle of it. So then what you see here with all the earthwork here, the taxiway will actually shift out to here and then come back in and then continue. But also for the airfield lighting vault, again, at the base of the tower. So all of the lighting for the runway, touchdown zone lighting, centerline lighting, wigwags that we'll have on the runway as well, and taxiway alpha, all of that new lighting and the regulators will go in that building because our existing airfield lighting vault doesn't have any space.
Amazing.
Some additional developments. So I believe most of you are out there during the mayor's breakfast with our new FBO, Aero Center Lakeland. So just to represent where they sit, this is Publix's hangar up here. This is their ramp, and then their subsequent hangars will be built here in this location. This is what it looks like today. It actually looks better than that because it's complete and they're actually up and operating. So this is where the fuel tanks are sitting currently. This is a triple wide trailer, which is pretty nice inside. I got a picture of it actually, that they're able to operate out of, and their 120,000 square foot ramp out here. It's all concrete, so very expensive. And next, this is inside the triple wide trailer, so it looks very nice in there to obviously for all their guests that are using their facility. And then as far as their hangars, I believe they will be coming out of the ground here shortly. We're just waiting for their steel deliveries. So there'll be a 10,000 square foot hangar, a 15,000 square foot hangar, and also their 5,000 square foot terminal facility, which is the glass building that you see here. So they are moving rapidly along. So again, a lot of development that continues out at the airport. Also, just wanted to follow up with Noaa's expansion. So they are complete. We completed all of their construction, a $13 million expansion for them. And it's quite an impressive facility. I know we haven't all had the opportunity to go out there because of COVID and their requirements to not have visitors right now. But just to point out, this is the front of their what we call the phase 1, and then the addition is this phase over here. Also, if you recall, the generator that we put in for them is sitting right here. This is a picture of inside. This area right here, their new offices that we have constructed for them. This used to be part of the storage area, which we shifted over to the other side now. So we've added significant office space for them because they're planning to add another 50 to 60 personnel out there at the facility. And then also, you can see here the new hangar piece as well, which houses all of their smaller aircraft, so their King Airs, their Twin Otters. I believe they're getting ready to sell their Twin Commander, but the larger aircraft again sit in the bigger hangar. Which sits right here, and they're getting ready to take another Gulfstream 5, which is about a $120 million airplane, and I believe in Congress there's a request for another G5 as well, so we'll be able to house all these assets here. So it is quite the facility. It's about 176,000 square feet, and I believe they're very, very happy because we don't hear much. And also they're very busy, and they're flying around the clock right now. We just had Fred, and they're going to be flying Grace as well, so that they've been pretty busy as of late. So real quick, and to kind of wrap this up, air service development is obviously near and dear to my heart and something we're very, very active on right now. So granted, even with the pandemic, we have been very, very busy talking with the airlines, meeting with them. Specifically in the last month and a half, I've been to what we call 2 speed dating meetings. I was just in one last week. So we've had a lot of meetings, but the pandemic has completely changed how the airlines are looking at their networks. Now, when we go back to last summer, for example, and even through this winter, as the pandemic was kind of subsiding, right? And there were lots of opportunities out there for airports like ours, but unfortunately, things started to slow down, the airlines get back to business as usual, and it's like, well, we were getting close, but then, now we've got to refill and put capacity back in all these markets that worked before. But what I would tell you is there's that opportunity still exists for us. And, unfortunately, even with the Delta variant, they're coming out, they're getting back to business as usual. They may go back and things, unfortunately, are going to change again. So they're still feeling out where they're going to go. What I would tell you is some of the positive things for us, if you look specifically at Southwest, for example, they're now in Sarasota, and they're doing very, very well there. Tampa, Sarasota. They're now in Destin when they're in Panama City. So the whole argument of, well, we're between Tampa and Orlando and we're relatively close, I specifically told them last week, it doesn't work anymore, because now you're right, you're next door in 2 different markets, and there's great examples of that. So our opportunities are coming, but it's about staying in front of these folks, because what's happening too is over time, and all these discussions I've had over the last decade, all of these airlines and network planners, they change, and there's a lot of churn and turnover, and that's unfortunate for us, because you spend an awful lot of time, having meetings and going over these things in your market and not the opportunity that exists, and then we fall behind. But the thing is, we just have to stay in front of these folks, as time goes on. It is not easy, and as I've said it before, but I will tell you what does make it much easier for us and does open up their eyes is the fact that the revenue guarantee is hopefully back in place in this budget. Our partnership with the county is strong as well. Our marketing partners with the county are strong. So being able to go and talk to these airlines and saying the incentives that we have available for them, it does go a long, long way. So is anything imminent at this point? No, but I will tell you the discussions have been robust, and at the end of the day too, we want the right partner. There are opportunities that have come and gone of, like a direct air that we had in the past, we've had those again, but that's really, I don't believe, where we want to be. I mean, we could run a bunch of passengers through here real quick, but in order to get what we want long term and what we believe is going to be successful, it's going to take us a little bit more time, but we are getting there.
Commissioner McCarley.
When you look at the pilot shortage as a limiting factor again, does aerospace help you at all with any of that, and Polk State being out there, that the fact that they could have homegrown pilots down the road? I know that's not very fast, but does that have any part of it?
It helps in Polk State College. They have partnerships with a lot of the regionals that are out there, and it's a great story, but unfortunately, it's not enough. I mean, literally, you have to take what we have, and we're fortunate to have here on our airport. You need to take it and put it on 5 airports in every state in the United States of America to even make a dent in this pilot shortage. I love my airline friends, but they have created this problem for themselves. I mean, there's some other dynamics that help create it, but they're starting to focus on it, but I think it's a little bit too late. And what's happening now is as they add capacity back in, they furloughed pilots, people are off doing other things, they have to get people retrained. You saw Americans had challenges, Spirits had challenges with crews because they furloughed people and you have to bring them back. You got to train them back up to get back in the cockpit and go. And that pilot shortage isn't helping us. That's hurting us again, because the majors, the big airlines, are going and plucking pilots out of the regionals that we would most likely have flying to Charlotte, for example, on American. They're plucking those pilots out and put them into the big airplane seats, and that causes challenges for the whole network.
Yeah, what makes us more attractive is because they'll have to deal with that shortage. Which makes us more attractive is our Central Florida centricity, the ability to be able to have a Cat 3 ILS for them as they come in, and just the facilities that we will continue to provide. And when you can be in Central Florida and increase market share utilizing a ready-to-go airport, that is very, very attractive.
Yes, we are ready to go. I mean, this is something, airline comes in XYZ, it's 90 to 120 days to get TSA back, and we're ready to operate. And the costs for us don't increase exponentially because we operate like we're a commercial airport already. We have to pay for law enforcement officers and things like that, but we just have to turn on the switch and go. But I will tell you, when they see our facility, the fact that we have a Cat 3, that we're ready to go, we're a 139 airport, I mean, it puts us up on as far as their board and the radar, we're on a lot of airlines' radars right now. So it's just getting that first one to pull the trigger.
Yeah. Well, and a pre-COVID question, because I know we talked about it before COVID hit us. You had pulled some numbers, Gene, on how many people in different zip codes in and around Lakeland leave Polk County every day to go to Tampa or Orlando to fly. I know COVID probably, no pun intended, hijack that. But, are those numbers, are you starting to see those return? Have you looked at any numbers post-pandemic yet?
Well, it's hard to look at those numbers post because it's like a year lag, but when we did our leakage analysis in 2019, about 2,600 people a day, and now granted, in our catchment area, we shrink it so we're not getting close to Orlando or Tampa, and this doesn't even include Auburndale, for example, because we want to keep it close. 2,600 people a day pre-pandemic were flying out and flying into our community. The 33813 area code alone generates 406 round trip pre-pandemic, 406 round trips a day. 33811, where I live in Morgan Creek, right next to the airport, is close to 200 round trips a day. So even when you look at close in, just right around the airport, if we're talking 70, 90 seat regional jets, we're really not asking for a lot to what we call put butts in seats, so it's completely doable. And when you look at the dynamics as well as what's happening as far as net migration to the state and to Lakeland specific, hopefully a lot of you have seen this, we're the second highest in the United States as far as net migration. We know we're growing. All the variables and those things that weren't, Great Recession, back in early 2010, 2011, that weren't in our favor, all of this growth, all of this development, all these people moving here has really put us, people are paying attention as far as the airlines, and this is a real opportunity for them now.
Commissioner Music.
Yeah, thank you, Gene. I think that our airport is just one of our gems here, and I just thank you and the crew for everything that you guys do. In fact, I was telling you before, we're one of those people that fly out a good bit, and I was just in your old stomping grounds and flew in from Dayton last night. Two questions. One, when you were talking, the very first thing you opened up was some additional warehouse space for the maintenance. Are those built speculatively, or okay? So those will be with something else. And you go through a lot of numbers and acronyms and things like that. So can you explain, when you're talking about runway length and things like that, what does a 727, an airplane of that size need, and what do we offer?
So existing today, we have obviously 927, which is going to be changed. I'll just add some confusion. Will be 1028 when the ILS goes up because of the magnetic heading. So we're going to 1028. Which is
why I'm asking the question. Yeah. Obviously, I don't know.
927 or future 1028 is right here. It's 8,500 feet long. The crosswind runway 523, which will be demoed for the future parallel. 523 is 5,000 feet long, and then develop the new development area up here in the northeast corner is what we're representing. So as far as like what a 727, 737, 5,000 feet will not work for those size of aircraft, so they have to use 927, and that's why also we're taking out the crosswind 523 and building the future parallel. Because when we need to take down the big runway for maintenance, we need to be able to still be able to operate. Okay. Yes, sir.
So any traditional plane that we would fly anywhere can come and land in our airport.
That's correct.
Thank you.
Commissioner Walker and then Commissioner Reed.
Thank you, Mr. Mayor. Thank you, Mr. Conrad, for, I guess what I would call an update to where we are with the master plan. And certainly we appreciate the fact we know general aviation has been our bread and butter, I would say, for many years, and after you come on board, even expanding that particular opportunity has been very rewarding for our city. But now, as we approach, and I would say somewhat the end of this master plan kind of situation by year, 25, 26, if I understand that correct? General aviation still being popular among for us, in hopes of bringing in commercial airline as well. You are reconfiguring, as I imagine, this particular plot of land to make sure we can still maintain both general aviation, all the things that go along with that, but also have commercial coming in as well. Now, is that what I'm saying is happening as we step through these fiscal years of this master plan?
Yes, sir. So great point. General aviation, we're a general aviation airport. So anything general aviation, that is our bread and butter. Now, granted, we have bigger things, obviously Noaa and Amazon or whatnot. But even when you look at our master plan, all of these blue hangars here, that's all just general aviation development to house aircraft that we know and believe are going to come to us and continue to come to us. Because again, sitting on the I-4 corridor, the KTTW hangar, for example, that was 60,000 square feet. That aircraft, or that hangar is full of jets. With the new FBO coming on, that's going to accommodate additional general aviation traffic. Shelter is building new hangars to accommodate new general aviation traffic. Over time, we'll build new hangars to accommodate, smaller single-engine aircraft. I believe in 2010, when I got here, we were at 167 based aircraft. We're probably at about 270 based aircraft now. So we've seen a lot of aircraft just come and flock to us because I will tell you, we are GA friendly. Obviously, with Sun and Fun on our great fly-in, we're super GA friendly. But again, when you look at our airport, we're very, very unique in all the things we do. We do RC model flying with big airplanes and general aviation and Draken and Noaa and all of that. And we're going to continue that uniqueness and do what we do as Lakeland.
Thank you.
Commissioner Reed.
Thank you. Good morning, Gene. I know how's our customs doing out there? What's happening with our customs?
Well, customs has been difficult because of the pandemic, but we're open. I will tell you, I'm going to go back to early 2020. Customs and Border Protection did come to us and gave us the opportunity to where we could have shuttered the customs facility for a quarter and saved money, but we made the decision not to do that because it took us 4 years to get them here and operating. And if we lost them and said go away for a quarter and then come back, who knows with everything that's going on in the world today if they would have. But so we've maintained that. It is used quite often, actually, not to the numbers prior to the pandemic, but it is being used quite a bit for aircraft coming in and out. And Noaa uses it as well, for example, because they're basing out of Aruba. So when they started to fly Fred, they go to Aruba, start flying it there, and as it gets closer, they come back. So they come in, they clear customs, and then go back to the hangar.
Thank you. Also, from our realtor friends listening, what are the size of the restaurant area, and what do you anticipate that rent being?
The rent being?
Yeah. You got any idea what we rent?
I think the restaurant's about 5,000 square feet. I do not see the new operator paying rent in the first year. We're going to need them to get going. Our history and what we've seen with the restaurant in the past is we've subsidized it quite a bit, so that we need to help them get up and going. But I do know they're probably going to want to do some renovations to the facility to get it going. But we probably would waive the rent in the first year and then do maybe some kind of percentage of gross as we move forward to help them out and make sure they're successful as they move forward.
Thank you.
Other comments or questions by commissioners? Thank you so much for this annual update. We appreciate it very, very much, and the leadership that you provide and continue to, and your team.
Team, thank you, sir. I just want to point out, I know they're watching back at the office, so if I didn't say something, they'd probably shoot a Nerf gun at me or something like that, but they're awesome. They do a great job, and we appreciate all their help to get all these things done, so thank you.
Thank you.
Thank you.
All right, that brings us to a proclamation. The Lineman Appreciation Day. And here to receive that is Tracy Moore. Tracy?
Tracy couldn't be here.
She couldn't be here, so Tracy's looking more like Joey.
I came up to accept this on behalf of Lakeland Electric's linemen. As a former lineman, I understand what all the dangers that goes into this job and the commitment that they have to our customers and our community. And I know that they really appreciate this. Tracy as well, all her work to get the Florida Lineman and Appreciation Day set in August. And one other thing, the FMEA, some of y'all on the board know, has really pushed hard to get a Thank a Lineman license plate approved for the state of Florida. And they're just waiting to have, I think, 3,000 pre-sold to roll those out. So our linemen really appreciate it when they see that and when they see things like this. So on their behalf, thank you.
Well, and the way they can do that on the FMEA side in terms of that license is if they register as one of the people willing to be an early 3,000 online, then they don't commit themselves to having to do it unless they put together 3,000. So that's an interesting way to encourage that among people within the electric industry. Whereas America is powered by thousands of independently owned, operated electric generating facilities known as power plants that generate electric energy. And whereas those power plants are connected to a complex energy system called the electric grid that is comprised of over 5 million line miles of transmission and distribution lines that deliver energy to homes, businesses, churches, hospitals, and schools across the country. And whereas the electric grid must be in operation 24 hours a day, 7 days a week, and 365 days a year in rain, cold, hurricanes, and tornadoes, and must be capable of withstanding any hazards that occur. And you can go to other areas of the country, of the world, where countries don't have electricity all day long. Every day is just part of the schedule, and interruptions are prolific. Whereas this system of electric lines is kept in high state of readiness by 114,000 dedicated and skilled men and women known as electric line workers that work for all the electric utilities across America. 114,000. Whereas electric line workers are a cohesive group that must work as highly effective teams in very hazardous situations under very rigorous conditions that respond to disaster areas to restore power to victims' homes. Their job classification has been ranked as one of the most 10 dangerous jobs in which 30 to 60 people lose their lives every year. And whereas Lakeland Electric's line workers have demonstrated their dedication and skills by winning numerous awards and competitions held across the state and nation and deserve the appreciation of the Lakeland community. And whereas the line workers from Lakeland Electric are particularly dedicated and hardworking men and women who risk their lives daily, working in extremely dangerous situations to ensure that reliable electric energy is delivered to Lakeland homes and businesses, which we take for granted. Whereas it is most fitting and proper that the City of Lakeland set aside a special day to recognize and honor these dedicated professionals, now therefore I, H. William Mutz, Mayor of the City of Lakeland, do hereby proclaim Monday, August 26, 2021, as Lineman Appreciation Day in the City of Lakeland, and call upon the people of Lakeland to be mindful of the dangerous work done under exacting conditions day in and day out by these dedicated workers, and show their appreciation at every opportunity by recognizing linemen throughout the City of Lakeland. In witness thereof, I have hereunto set my hand and caused the official seal of the City of Lakeland to be affixed this 16th day of August 2021. Here you go, sir. Thank you very much. All right, that brings us into the core of our meeting and committee reports and related items. So in the agenda, if you see Real Estate and Transportation Committee report, that meeting was held on the 13th by our chairman, Commissioner Reed, and he's going to bring us up to speed.
Thank you, Mayor. August 13, 2021, the Real Estate and Transportation meeting met via go-to meeting. The meeting was available for viewing on the public line as well as local channels. Commissioner Bill Reed, Chair, Commissioner Chad McLeod, member, were present. Members Mike Music was absent. Mayor Muntz, Commissioner Sarah McCauley was also present along with staff. I called the meeting together at 8:23 a.m. The order of business that day was for the sale of city-owned property located at 1130 Atlantic Road. This was a proposed sale and agreement between the City of Lakeland and Kim Thomas for the sale of city-owned property located at 1130 Atlantic Road at a purchase price of $140,000. The purchase, sale, and agreement was to close September 10th, 2021, contingent upon the buyer obtaining financing and a satisfactory conclusion of a 15-day inspection period. The city would pay dock stamps on the deed as well as a 2% real estate commission to the buyer's agent. The buyer would pay all other closing costs. Staff recommended that the City Commission approve the sale of 1130 Atlantic Road to Kim Thomas upon the outlined terms and condition and authorize the appropriate city officials to execute this agreement. Commissioner Chad McLeod moved to approve the sale. Commissioner Reed seconded. The motion carried unanimously. Our meeting was adjourned 5 minutes later at 8:28 a.m.
Is there a motion to approve the report?
Motion to approve.
Second.
And a second. Discussion by commissioners. Commissioner Reed.
Thank you. There again, for a little bit of transparency, I see we have our housing group here, and it may assist other people if she might get up and explain the actual program this came from, because we have money available that people can do some fixing up and stuff of that nature. So I'm glad you're here.
Good morning, Annie Gibson, Housing Programs Supervisor. So with our regular rehab program, income level, we are assisting with housing repairs for low income, under 80% of the area median income. Unfortunately for this homeowner who qualified to have her house repaired, and we had to eventually demolish her home, she passed away before that happened. And that's how we went through the legal process to get this house back. So we went through, of course, foreclosure. We did offer the home to her heirs, and they were did not want to relocate their homestead to this particular place. So we were able to go through foreclosure, get the home back, and we were able to sell to a low-income home buyer. With our regular program, which is open to all income level folks who qualify for the program, who live within the city limits, and just by chance, we have our new online application, which is available now at the housing's website.
Thank you. Can I continue?
Yes, sir, please,
Okay, good.
continue.
And so,
Speak loudly.
pardon me?
Speak loudly.
I guess this was a home that they owned and then went into a rehab program, and so we rehabbed the house, or it's a beautiful home. I drove by it. I couldn't understand why this particular person didn't want to keep the home per se versus relinquish it to the city for sale.
Well, she was on an application list. She qualified, income qualified for the program. Her home was in such disrepair that we had to rebuild the home on her lot. 2 weeks before we were to hand her the keys, she passed away. So we offered the home to her heirs for an income qualified home owner. They did not want to relocate to that particular area. That's when we went through the foreclosure process to of course, get the monies back, the grant money that we had spent. And pretty much over $120,000 with constructing the home for $100,000 and some electrical maintenance and some mowing. So all the funds that we would have invested in the program is going to be reimbursed, and we apply as program income to the grants.
Excellent. I'm glad to see we're making a profit on a home here for a change.
Well, I think it's
Commissioner Walker.
I think it's important too, Commissioner Reed, that, people understand, like you just said, the program, because you do have the situations such as that, and several others in past years have happened where someone dies, and the heir, they always work to see if they wish to remain or stay in that particular place. Some don't want to do it. So if you don't want to do it, then you have to go through another process of, making sure that we get what we can get and offer, again, someone who's eligible, of course, to be able to live, and I call it, again, an affordable kind of a situation. Would you not agree, Ms. Gibson?
Yes, sir. That's the purpose and the focus of the program.
And while I have personal privilege, if I could, Mr. Mayor, there's a gentleman in the audience that wishes to speak after our meeting is over, and the situations are such that he needs the support. And as I shared with him, as he approached me here this morning before the meeting, how he can connect with whom he needs to connect with for a similar almost situation where he's in need of housing and that kind of thing. So Ms. Gibson, I don't want you to stay around, because I know you don't stay around to the very end to hear comments from citizens who wish to come and make comments to us as a commission. But the gentleman is in the back, and if you can make contact with him, if he raises his hand, if you can just give him that way, you want to stay around,
Okay.
and he can get to someone right away to talk about his particular situation, because he did not know. He didn't know the process, he didn't understand the process. And as he approached me, because he lives in my district, I told him, I said, sir, someone will be here. And I knew you'll be here, so that can help that situation out right now. as you exit.
Yes, sir,
You
I'll
can
make
talk to me,
contact
okay? Thank you, Mr. Mayor.
Thank you. Other comments from commissioners? All right, any comments by the audience? This is a voice vote. All those in favor signify by saying aye. Aye. Opposed, same. Unanimously passes. That brings us to the consent agenda, which is the minutes as well as the 2 items that you can see on asterisk on page 2. Is there a motion to approve?
Move to approve.
Second.
And a second. All right, discussion by commissioners. Any questions or comments by the audience? Seeing none, all those in favor signify by saying aye. Aye. Opposed, same. Also unanimously passes. That brings us to the request to appear from the general public, of which there were none in advance, and then equalization hearings, which we do not have, so public hearings. A1, ordinance, second reading.
Mr. Mayor, we have one ordinance for second reading and public hearing this morning. Proposed ordinance number 21-033, an ordinance of the City Commission of the City of Lakeland, Florida, relating to the city charter, adopting findings, amending Section 6 of the city charter to provide for the filling of vacancies on the City Commission by election at the next available regular city election, providing for the appointment of an interim commissioner to fill a vacancy until the next available regular city election, specifying qualifications of an interim commissioner, amending Section 84 of the city charter to provide for alternates on the canvassing board, providing for the repeal of ordinances in conflict herewith, providing for severability, providing an effective date.
Move to approve.
Motion to approve by Commissioner McLeod and a second by Commissioner Music. Discussion by commissioners. Commissioner Music.
I just want to say I think it's great. I think it's a great savings for both the citizens, and I think it helps with continuity and not again as one that's in that position. I think that it's a wise move. So I appreciate the wisdom and the legal team figuring that out. So.
Commissioner McCarley.
I just wanted to give kudos to City Attorney Davis and his staff to work through this. As we said in our workshop a couple weeks ago, it was an arduous word problem to try to figure out how to make it concise and clear, and I think you did a really good job looking over it this weekend. Thank you so much for your diligence, and it will be better serving the community at large by, I think, cleaning this language up. So thank you.
Agreed.
Minimizes confusion, reduces unnecessary costs. Excellent work to be done, and also takes for our city clerk on the canvassing side a major headache and concern away when there's many people running for positions, as evidenced in this year. So it's two things that we're talking about in this. Any questions or discussion by the audience? This is a roll call vote. Commissioner Walker?
Aye.
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 Yes.
Aye.
Aye. Unanimously passes. B1, City Attorney Davis.
B1 is proposed resolution number 21-055, a resolution of the City Commission of the City of Lakeland, Florida, relating to non-ad valorem assessments, adopting findings of fact, adopting a non-ad valorem assessment role for unpaid lot cleaning and clearing and demolition non-ad valorem assessments, electing to utilize the uniform method of collecting non-ad valorem assessments as authorized under Section 197.3632 Florida statutes, for collecting said assessments, authorizing the city attorney or designee to certify the assessment roll to the tax collector, providing for severability, providing an effective date.
Move for approval.
Second.
Motion approved and second by Commissioner McCarley. Discussion by commissioners. Any discussion or questions by the audience?
And just for the benefit of the audience, I just wanted to, this is the opportunity, if you received a letter about a special assessment against your property as a result of demolition or lot clearing, to address the City Commission. Just for the benefit of the City Commission, this is the last step in the process that has been going on for quite a while now. The first step is a property is observed as being in non-compliance, the grass is overgrown, or there's a dilapidated structure on the property. Receive a notice of violation, the property is not corrected, and then an invoice is submitted that goes unpaid. Then it goes to an equalization hearing that you all see every few weeks, where another notice is sent to the property owner. They're given the opportunity to address the City Commission. We've gone through all those steps. Now this is the last step in the process where an assessment is still unpaid, and we hold a public hearing per Florida statutes, and then forward these assessments to the tax collector for collection on the tax bills.
All right, and did you want to address the dais now? Yeah, then can you come up to the dais, please? Which is where those two little microphones are. And if you don't mind, when you get there, please state your name and address.
Good morning. For the purpose
Morning.
of this hearing, my name is Vanessa Wilson. Legal name on the property is Vanessa Poole. That was my married name when I had the property. I received a notice regarding collection for special assessment dealing with the property of 937 North Iowa Avenue. When I received the citations for the property prior to the demolition, it was because of structural damage and everything that had happened to the property, and I had since moved from this area to Central Florida. I meant to South Florida. And the repairs were just a lot, so I put in the request at the time with Mr. Browning, dealing with code enforcement, to properly do what needed to be done to demolish the property. So that's what I did. And since then, I've accrued the cost of the demolition, which they had the hearing and stated that what would be left for me to pay levy on the property. Since then, this was done last year, and this is the first notice that I'm receiving in regards to this notice of the demolition costs and everything outside of the initial letter that I received. So I'm here because of, I guess they're trying to go ahead and get the payments for that, because I wasn't understanding exactly what it was saying on here, where they're going to be adding this cost to the tax portion of that's received. Because when I saw the November, I was like, okay, that's when the tax paperwork comes out in November for payment. So I wasn't sure if this was something that I was going to have to pay all at one time when the taxes were coming out, or what, because I'm traveling up here from South Florida today to come to this hearing.
What was that address again? I'm sorry.
Excuse me, 937 North Iowa Avenue, because Mr. Browning was involved in the beginning, and then it went to another gentleman, but I didn't bring the paperwork of who I was texting back and forth and emailing regarding the issue of the hearing for last year.
What page is that on?
Well, I have a question. Are you willing to take care of the cost of it right now? Because of what has happened, because you agreed for demolition, if I heard you correct. You did agree for the demolition to happen. You said you just were not aware.
Well, I voluntarily went into, because I did try to do an assessment of how much it would be to try to rehab it, because I had homeless people living in the home, and I'm in the property and everything, and they had done some structural damage, as well as it was an investigation going on because they had burnt down the house behind my residence and caused a fire in this residence.
I think his question is, are you prepared to pay that fine, that cost?
That cost, now, no, the cost is rather high. I mean, I know that when I agreed to do it, I had been, due to the pandemic, all of last year, I just started back working. So I haven't been able to make any payments on this, because I haven't had a job since the latter part of last year.
To answer the question, I mean, when the tax bill comes out in November, you have the option of either paying it all then. I think the tax collector does have a program where they allow installment payments.
Okay, well, that was my question that I was trying to ask, because I noticed that it said something about putting this mailing to taxpayer in November, so I wasn't sure if this total cost was going to be going to the tax payment or in exclusion, or how it was being done. That was what I'm trying to get to, so I could start making payments now that I'm back working, to start taking care of this issue.
And the answer is yes, the entire amount is going to the tax collector's office.
Okay.
For collection in November. But,
Okay.
but once again, the tax collector's office has a program for installment payments.
Okay, so I would need to contact the tax collector's office about the program?
Correct.
Okay, that's what I needed to know.
That's what I want to make sure.
Yeah, because I wasn't exactly sure if I was required to pay today or in November, or how it was going, because, I'm first-time home buyer. I didn't know how this went.
All right, so your responsibility is to make sure you deal with the tax collector's office.
To get the payment arrangement set up.
Our responsibility
Okay,
is continue to leave it in as written, correct?
I mean, you have the option of taking it off, but, I think that, our recommendation is to leave it on there.
Okay. And it doesn't, in other words, you still do what you need to do with the tax collector's office. It just remains in our list, so that if you did not work out arrangements with the tax collector, you would lose the property.
right, okay. Thank you so much. That cleared up everything for me.
Appreciate it.
All right.
Any other comments or questions?
Do I need to get paperwork, or do I need to do anything, or can I get back on the road?
No paperwork at this point in time. You will receive a bill from the tax collector's office.
Okay.
At the beginning of.
Well, I'll get back in contact with them in regards to the letter and how to set up the program and everything.
So you can go.
Just drive safe. Yep.
Okay.
Yes, Commissioner Walker.
Yeah, I got a question, because I've seen, over the years, these numbers up before us. Is Mr. Ruiz here?
Yes.
Yes.
Mr. Ruiz, the cost there, I've seen different numbers when it comes to demolition and that kind of thing. Is this a cumulative total of cost for certain things besides demolition as well? Just want to make sure.
When you get the non-ad valorem assessment roll, I guess I can take this off at the podium.
Thank you.
Good morning, Brian Ruiz, Interim Director of Community and Economic Development. So when you see a typical monthly equalization roll or agenda, that is a single instance of a lot clearing in the case of lot clearing equalization or demolition, if it involved a demolition. When this once annual exercise of the commission to pass a non-ad valorem assessment roll comes around, the attorney's office working with finance customer billing compiles all of the unpaid but previously equalized lot clearing and demolition assessments for that particular property, adds them all together and puts it on as a single non-ad valorem assessment. Those amounts are comprised of the hard costs that the city has paid a contractor to cut and clean and or demolish a structure on the property, the administrative costs that the city commission has authorized by resolution for lot clearing is $165. For a demolition, it's $880. And then whatever interest has accrued on those unpaid charges up until the time the attorney's office prepares the non-ad valorem assessment roll.
So it's a cumulative of dollars that we see comprised here to make up this particular number we got.
Correct.
Although more than likely, this is just related to the demolition. It's possible that there's one or two lot clearing assessments on there, but the bulk of that is obviously demolition.
Mr. Reed.
Thank you. That was interesting. I didn't know that. I was interesting this. So this could be a multiple of fines accumulated at this particular point. Is that a fair statement?
Would be.
It is.
It is very common, yes, that a non-ad valorem assessment, such as you are being asked to approve today, is comprised of more than one lot clearing, not more than one demolition usually. But yes, over a period of we do them pretty well annually now, so they don't get more than a year, maybe two behind, depending on the timing of the initial assessment. But the ones that you are looking at are very commonly more than one lot clearing charge.
What interest rate do we charge?
It's 8%.
Okay.
Yep.
Right. Any other comments or questions? Any other comments or questions from the audience? On this matter? Yes, sir. Here, no, just come up. You need to come up, sir. Just your name and come on this side, and she doesn't have to move if you want.
Yeah.
So you'll be, yeah. We'll let them go first, and then you can follow. Thank you.
I know. It's. I would hope so. I would hope so. I would hope everything is included in it.
Okay, yeah.
I would, at least she's only paying one fee as opposed to.
Just please state your name and address. Thank you.
Good morning.
Morning.
My name is Conchita James. I'm here on behalf of Olamay Morris Lovett. The home is on 616 West 7th Street. Okay, her mail, I'm her stepdaughter, her mail comes to my address because I had to have her address changed because her mail was coming there and she wasn't receiving it. and I received this letter on that property. So it said to rephrase the cost of providing lot cleaning and or demolishing service on the above property. So Ms. Morris is not here anymore. So what's the next step on this? Because I've paid some money and I've been having the lot clean. But then it comes to my attention.
Well, who owns the lot today? She does?
She does.
And is she living?
No, she's
deceased.
deceased.
What happened? She and I take care of her until she died.
What did her will stipulate?
She didn't have a will.
She had Alzheimer's real bad and she deceased.
And if she had any kind of papers or whatever, I don't know, because the house was ramshackle. So, and it had rats in there too, so, you know, I ain't want to go in there too deep in there, but she didn't have a will. I was really, and my husband was her caretaker, you know, because someone had to take care of my stepmom, and she wasn't a stepmom, she was like a mom. But her mail, she wasn't where she was getting her mail, and she wasn't getting it because the people next door finally got in touch with me and my brother to let us know she had mail coming to her address, but she was sending the mail back. And even if my mom did get the mail, she, you know, she really didn't know. And by the time I really found out about this, the Alzheimer's she had, it was kind of too late, you know, but I did the best I can. And I did have her address changed to my address because she didn't know what was going on.
So we're going to let our city attorney weigh in on this.
Okay.
What will happen is that the assessment will go to the tax collector, as with all the other properties. A tax bill will be issued to the estate in November. If it goes unpaid, ultimately a tax certificate will be issued against the property. The property could ultimately be sold at a tax sale as a result of that, or if the property is probated, the assessment would need to be paid as part of the probate of the estate.
And you could buy it.
Okay, what time, if we get into this probation thing here, what time would the money have to be paid? In November or what?
Well, I mean, the tax bill goes out in November. You get a discount if you pay, in November, and then it goes up a little bit every month. And I think April is the final month you have to pay a tax bill before a tax certificate is issued. So you have a little bit of time to pay it this year. When a tax certificate is issued, the holder of that tax certificate has to wait 2 years to apply for a tax sale. So before a tax sale is held and the property is potentially lost for taxes, you have approximately 2 years.
Okay, what's happening now? Her name is not listed on anything. She doesn't, her parents didn't have a will. So really, she's not eligible because her name is not on anything. So,
I mean, you don't have to have a will to probate an estate. But if there's not a will, state law dictates who the property goes to. It specifies an order of people that you give the property to. And so you would still need to probate that with a probate court. And then state law will determine who has priority as to getting the property.
Okay.
Okay, thanks.
All right, thank you very much.
Thank you.
Mayor,
Yes, sir. Oh, I'm sorry, Commissioner Reyes.
are they trying to get reimbursement for their mowing fees? Is that what they want to do? If they can file a lien against the state, I mean, her estate, and do that.
That's what they're trying to do.
Reimbursement for what fees?
I thought are they trying to get reimbursed for their fees? Is that what they're trying to do?
No,
No.
they just trying to.
No, the thing about this is we want to know the right way to go or whatever, because like we said, I'm the stepdaughter. I don't have any paperwork or anything on Miss Mars. Now, like I said, no, it wasn't like a reverse. I might not be saying it right, but what we were saying, if I will pay this money and it goes in probate, then what? Because the only family she have left really is me and my brother, and he's not fighting because every other family has expired.
I think probably your best first step is to go down to Bartow to the clerk of court's office, and they have forms that they can provide to you and get you started in the right direction.
Okay.
So they will be able to help you some.
In Bartow?
Yeah.
Okay, do I go to the courthouse?
To the courthouse, yes.
Okay.
And it's possible you could do that in Lakeland as well. I'm not sure if they have the same services as Bartow would have for something like this.
Okay. Thank you much.
Thank you. There she's going. Okay.
Mr. Mayor?
Commissioner Music.
Yeah, and I just have a general question, and I think that the question was answered by the attorney at the end, but I just want to say thank you because this is an awful weird situation, and giving them the first step is great. I mean, obviously it's not our responsibility, but I just want to say thank you for the kindness, because that was my question. I felt like maybe she was moving on and didn't get the right answer she did, and I'm thankful for that. I think you've got a good direction to go, so thank you very much, and thank you, Palmer. I appreciate it.
And I think, it's from a historical perspective, we've done that always. We've always, Mr. Music, provide, in our city attorney's office, provide at least a way for the customer or the client or citizen to know what you need to do to help your situation.
Yeah, well, I just want to recognize that, because it is. That's great.
Yeah.
Thank you.
Yeah, that's good, yeah.
All right, sir. Please state your name and address.
Yes. My name is Wendell Carson. I received this letter for 618 West 3rd Street for cleaning up the lot and stuff. All right, my house was, I think it was burnt down a few years ago or something like that. And I didn't have no idea about all this stuff here. My sister just bought me this letter. Now, what do I do about this?
What will happen is that this charge will be forwarded to the tax collector's office, and a tax bill will be issued in November to the owner of the property, and then at that point they need to pay the taxes for the property, and again there could be consequences if ultimately leading to the loss of the property if the tax bill goes unpaid for a certain amount of time.
Okay, I could pay the tax. Okay. That's all I need to know then about that. Love my sister.
The letter was talking about the cleaning of the property.
Yeah.
So that included the taxes and all.
Mm-hmm. Yes.
Okay.
It's going to shift to the property taxes that you pay of that property in the future.
Okay. Now, the house was, I think the city demoed the house. I don't really know because no one got in touch with me about anything.
I see.
Okay.
Okay. So you should be good as long as you pay the taxes appropriately.
Okay.
Yeah.
Thank you.
Yes, ma'am.
Good morning. My name is Felicia Jordan, and I'm here in reference to the property 647 14th Street. I purchased the property the end of last year, I believe, but it's in Eric Hilston, which is my son, because I drive trucks, and when it was time to close and I wasn't in town, so I had him to do the paperwork. But I have been keeping that property up. I know a few times when I got notices, it was like the day that it's saying that it needs to be done. I mean, I got the letter literally the day before. So, but it has been kept up, and I have no problem. Okay, maybe the letter is only for one cleaning, I hope. I'm not for sure. Y'all probably can give me the answer to that. However, I don't agree with putting a $500 extra on there. I mean, it's already ridiculous y'all charging $500 to just lawn the yard because it's not no debris, it's just empty lot, and we keep it clean. But I cannot get there every week or sometimes even 2 weeks to keep it lawn as low as maybe that y'all probably want it, and I don't think it's fair because I am keeping it up. The property was a tax lien property, and the taxes was like $12,000, way more than the property, but I purchased it because I wanted it. And I mean, I could have came in here and asked for, some of the money being reversed, which they told me, but I didn't have the time to do all of that. But it seemed like everything that I'm doing is like the city of Polk County is working against me to take it from me,
Mr. Roos, you want to comment on that?
Good morning again. Do you have your notice with you?
No, I don't.
Okay.
I rushed in here. I came
Okay.
off the road.
Don't leave. I'll give you my card, and we'll look into the exact charges and dates of those charges that led to the assessment that the commission is being asked to approve today. To the point that the city wants the property, obviously we do not. We have more property than we can handle ourselves, and so have asked the commission to create the Affordable Housing Land Bank, and so we're trying to divest ourselves of that vacant inventory for the very laudable purpose of developing infill affordable units. I will look into these particular charges to see not only the timing of them. I suspect that they predate her ownership. That's very likely. But also the validity of those charges, and if it's determined that we need to make a change to the non-ad valorem assessment roll before it's transmitted to the tax collector, I assume we can remove one.
That's correct. We have a deadline of September 15th to send the roll to the tax collector.
So we'll dig into this one at the staff level, see about that. And while I have your attention, you've heard a lot this morning about the tax assessment and collection process. For a few months now, the Community and Economic Development Department and our CRA have been working with Mr. Tedder's office on an education outreach program on this very topic. So on August the 31st at 6 p.m. at the Coleman Bush Building, the tax collector, the property appraiser, the clerk of courts, and our own City of Lakeland staff will be there to city staff mostly there to support the tax collector, but for this very reason, we've worked with a concerned citizens group to try to bring about a far greater level of education, not only about tax assessment, property valuation, but also how the processes that Mr. Davis referenced a few minutes ago, where tax certificate purchasing is concerned, and ultimately tax deed issuance, those public sales. So we've had several productive calls with those constitutional officers and are hoping that the August 31st event will be successful.
If I may add,
Commissioner Walker.
and I think it's important, and I thank you, Mr. Lewis, and thank you to our Community Economic Development Office and Department for doing it. But I got to say this: you have to stay on top of it too. I don't mean to be negative, but if you're getting letters, if you're getting notices, you got to make sure you make contact, because that particular our office does not know what's going on with you, so you have to make contact. And I have seen over the years, as we are with this young lady today, being supportive to make sure that, where we can to be of support and help and forgive, we do that. But you got to make sure that you do your part to make contact and stay involved with what the process is. And again, I would say a lot of it is education. A lot of it could be education, and I'm sure it is education on what and how the process works and what need to be done. And I thank you again for putting that on, because I saw it advertised here some days ago. I thought that's a good thing to have so people can know even more how best to handle these kind of situations. Thank you.
very good point. And I will be surprised on the 31st if estate administration, probate, things like that don't come up.
Yes.
Our code enforcement staff, our attorney's office very frequently work, well, you heard from our housing office also, work with the heirs of unprobated, unadministered estates to help them resolve code violations,
Yes.
to deal with debts and assets of that estate after a loved one has passed, daily, basically.
Yes.
So hopefully we can bring about a little more understanding on the tax side of things where that's concerned.
Yes, sir. Thank you.
So ma'am, I think that'll provide you with some continuity as you meet with Mr. Ruiz, and thank you very much for coming in. Appreciate it. Is there anyone else?
Thank you.
All right, this is a roll call vote, and we'll start with Commissioner Walker.
We're removing the one, am I saying that right?
We're not removing any.
We're not
In
removing-
other words, we're working through them. They have until September the 15th to
Okay.
finalize.
All right.
The
Okay, I wanna make sure I
list
was
remains as it
understanding.
is.
Yep, same question. Yep, thank you.
All right. Aye.
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 Yes.
Aye.
Aye, unanimously passes. Thank you, and appreciate your patience during that process. And that's important, and of course, that's the purpose of this, is to bring this to a closing head, so, because of the duration of time that's taken place. Item number 2.
All right, item 2 and 3 are similar processes, all the different types of assessments. 2 is proposed resolution number 21-056, a resolution of the City Commission of the City of Lakeland, Florida relating to non-ad valorem assessments, adopting findings of fact, adopting a non-ad valorem assessment role for the Orangewood Community Subdivision, electing to utilize the uniform method of collecting non-ad valorem assessments as authorized under Section 197.3632 Florida statutes, for collecting the assessment, authorizing the city attorney or designee to certify the assessment roll to the tax collector, providing for severability, providing an effective date.
Move approval.
Second.
Motion to approve in a second, and this is a great example of opportunities that the city will sometimes provide for a neighborhood to correct a problem,
Yes.
and for people to be willing to contribute to that and then have that
Yes.
payment for same shifted to their tax
Yes.
rolls, and that's what we're doing in this. Any discussion by commissioners? Commissioner Reed.
Thank you. Palmer, are both of these for 10 years?
The Orangewood was originally for 10 years when it was a large capital improvement project to improve the sewer system and stormwater system out there. This used to be several $100s, this annual assessment, so the City Commission decided to spread that over 10 years. Now this is just for the cutting of some common areas and the cleaning of the retention pond, so it's a small assessment. It's $38 per parcel. This is Orangewood is an ongoing assessment. The next one, Heather Point, will be for 10 years.
I knew the second one was 10 years. I just didn't know about the Orangewood. It's going to be perpetual for a while. Or what?
It's, as long as they want us to continue to do this, and we have the ability to do it, to clean out the retention pond and mow some areas for them.
Thank you.
They get paid. They get paid.
Any discussion by the audience or questions? Seeing none, this is a roll call vote. Commissioner McLeod?
Aye.
Yes.
Aye.
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 Aye. Unanimously passes.
Finally, is proposed resolution number 21-057, a resolution of the City Commission of the City of Lakeland, Florida relating to non-ad valorem assessments, adopting findings of fact, adopting a non-ad valorem assessment role for certain lots abutting Heather Point Drive in the City of Lakeland, electing to utilize the uniform method of collecting non-ad valorem assessments as authorized under Section 197.3632 Florida statutes, for collecting said assessments, authorizing the city attorney or designee to certify the assessment roll to the tax collector, providing for severability, providing an effective date.
Move for approval.
Second.
A motion approved in a second. Discussion by commissioners. Any discussions or questions by the audience? Seeing none, this is a roll call vote. Commissioner Walker?
Aye.
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 Yep.
Aye.
Aye. Unanimously passes. We have no Community Redevelopment Agency report. We do have a verbal from our city manager, yes?
Yes, thank you, Mr. Mayor. Just a couple of quick verbal announcements. First is just a repeat from Friday. Our Brian Ruiz, our interim director of Community and Economic Development, and his staff had developed a public forum called Build It, which was going to be held this coming Thursday. And the intent of that forum is to elicit feedback from the customers, primarily of our construction services, division. We are unfortunately going to reschedule that related to the increase in COVID cases. But we're looking forward to that, and just want everyone to know that Thursday will be canceled, but rescheduled to a later date, and we will make sure to announce that and publicize that heavily, because we did have a good response with a great number of people who wanted to attend that public forum. So again, we look forward to announcing that when we can actually hold that. And then finally, I'd just like to say, Commissioner Walker, I've been involved and interacted with the FLC for almost 20 years now, and that was a proud moment on Saturday, sir, to see you sworn in as the president of FLC, and so I congratulate you.
Thank you.
You're here.
You're here. All right, that brings us back to City Attorney, and we are at 6A1 in the agenda, proposed 21034 for first reading.
Yes, we have one ordinance for first reading this morning, and this ordinance will be read by title alone this morning, and we'll come back for a full public hearing on Tuesday, September 7th. That is proposed ordinance number 21-034, an ordinance relating to the Lakeland Area Mass Transit District, making findings, approving the inclusion of certain lands located within Parkway Corporate Center on South Pipkin Road in the city of Lakeland, within the boundaries of the Lakeland Area Mass Transit District, providing for severability, providing an effective date. Once again, that will come back for a public hearing on Tuesday, September 7th.
B1.
B1 is proposed resolution number 21-058, a resolution relating to public utility easements, making findings, vacating an existing 15-foot public utility easement on approximately 160 acres located west of E.F. Griffin Road and south of Wind Meadows subdivision, providing for severability, providing an effective date.
Motion to approve?
Second.
Motion to approve in a second, and discussion by commissioners on this. Seeing none, any discussion by anyone in the audience? This is a roll call vote. Commissioner McLeod?
Aye.
Yes.
Aye. Aye.
Aye.
Aye.
Aye. Unanimously passes.
Next is proposed resolution number 21-059, a resolution of the City Commission of the City of Lakeland, Florida, authorizing execution of an airport rescue grant agreement with the Federal Aviation Administration to prevent, prepare for, and respond to the coronavirus pandemic at Lakeland Linder International Airport, adopting findings, providing an effective date.
Move approval.
Motion to approve in a second.
Second.
Second, Commissioner Music. Discussion by commissioners. Seeing none, any discussion by the audience? It's a roll call vote. Commissioner McLeod?
Aye.
Yes.
Aye. Aye.
Aye.
Aye.
Aye. Unanimously passes as well.
Finally is proposed resolution number 21-060, a resolution of the City Commission of the City of Lakeland, Florida, relating to an issue election, finding that all applicable procedures and requirements for the calling of an issue election have been satisfied, calling an issue election for November 2nd, 2021 to conduct a referendum on proposed amendments to the Lakeland City Charter, providing ballot titles and ballot summaries for the proposed charter amendments, making findings, providing an effective date.
And there's a motion to approve. Commissioner McLeod, and a second by Commissioner McCarley. This is the one we talked about earlier, and I know you had a chance this weekend to go over it and look and see if there's any other modifications or changes you wanted to make, and it makes you appreciate the wording that's been done
Yes.
in a short amount of space to make it possible. Any other comments by commissioners or questions? Any by the audience? This is a roll call vote. Commissioner Walker?
Aye.
Aye.
Aye. Aye.
Yes.
Aye.
Aye. Unanimously passes. Good works. Thank you. We had the consent agenda earlier past C1. That brings us to our finance director, Mr. Brossart, who is going in the appropriation and increase in estimated revenues for the American Rescue Fund with respect to wastewater.
Yes, good morning. Mike Brossart, Finance Director. On July 13th, the City Commission discussed and approved a project, $20 million project to replace a major gravity sewer line known as the Southwest Wastewater Trunk Line. This was all part of the American Rescue Plan workshop that the Commission had. This approximate 2.75 mile pipeline has been in service for many years, and in the mid-1980s was rehabbed by slip lining a 30-inch diameter pipe inside the original 36-inch diameter. While this rehabbed the pipe, it then decreased the amount of volume that could go through those pipes
So, as discussed in the workshop, the utility has budgeted $2.2 million in their CIP capital improvement plan for repairs to the lower end of that pipeline. Unfortunately, it was determined that this whole pipeline needs to be replaced. So, to repair the remaining $17.8 million worth of the project, the commission agreed to use the ARPA monies, American Rescue Plan Act monies. We are getting those monies, the city's getting those monies over a 2-year period, 2021 and 2022. We've already received half of those monies of the $22.7 million. So what wastewater is requesting now is an appropriation of $8.9 million of those ARPA monies to be used with the 2.2 to start the project. And then a year from now, once we've received the additional monies that we have available, they'll request the additional $8.9 million.
So is there a motion to approve?
So moved.
Commissioner Reed and a second by Commissioner Walker. Discussion by commissioners. Commissioner Reed.
Thank you, Mike. Why wouldn't we ask for all the money up at one time?
Talking about for this project or for the ARPA monies?
Why don't we get the whole, all the money up, instead of breaking it into 8.9 million, why don't we get it all now?
Well, they don't need it all right now, but we've not received, we've only received a little over $11 million from the government, $11.35 million from the government, and we're not eligible for any more than that till a year after the first request was submitted.
Thank you.
We get 2 rounds of money, and that complies with that. Other questions by commissioners? Any by the audience? Seeing none, this is a consent. All those in favor signify by saying aye.
Aye.
Opposed, same. Thank you. All right, Utility Committee, we have items C, 2, and 3, and I assume we'll have Ms. Sirianni to make that presentation.
Good morning, Ramona Sirianni for the City Attorney's Office. The first item that we have is an agreement with AECom Technical Service, Inc. This is again for the project that the city has been working on, the relocation of our natural gas transmission pipeline in response to FDOT's road widening project along State Road 33 and improvement of the State Road 33 and I-4 interchange. There's a 3-mile portion of that pipeline that the city is being required to relocate. You saw before you on July 6th, the commission approved the short list of ranked firms and authorized staff to go ahead and negotiate a contract with AECom Technical Services, and what you have before you is that contract that will compromise all the engineering and construction management work. It'll be done in 2 phases. Those 2 phases, any work with regard to the project will be pursuant to task authorizations, which will be the next item that I'll present. So what you have before you is just a master agreement, a $0 amount contract. The work or the agreement will be effective October 1st, 2021, subject to your approval today, and then will continue through September 30th, 2023. There are 2 additional 1-year periods of renewal options should the city decide to exercise that. The city also reserves the right to terminate the agreement at any reason upon 30 days prior written notice to AECom. And again, we would ask for your favorable approval.
Move for approval.
Second.
Motion approval and a second. I didn't see the second. I apologize. Commissioner Walker. Okay. Discussion by commissioners or questions. Any by the audience? Seeing none, this is a voice vote. All those in favor signify by saying aye.
Aye.
Opposed, same. Unanimously passes.
The second item is the corresponding task authorization with AECom Technical Services. This is for Phase A of the project of the relocation of the city's natural gas transmission pipeline relocation project. This particular task authorization will encompass FDOT plans review, preparation of design plans and specifications for construction, the preparation of the bid package, permitting support, and also construction management. Phase A is anticipated to be completed by May 2023. All services pursuant to this task authorization will be in accordance with the contract that you just approved. All reimbursable expenses are going to be paid in accordance with the city's consultant expense reimbursement policy, and the total estimated not to exceed cost of the work here is $354,500, and that is included in Lakeland Electric's FY 2022 budget, of course, subject to City Commission approval. We'd ask for your favorable recommendation.
Motion to approve?
There's a motion to approve and a second by Commissioner Music. Discussion by commissioners? Questions? Commissioner Walker.
Thank you, Mr. Mayor. And maybe as a sidebar, kind of a question, but we know this particular situation needs to be taken care of before we can see it and work being done for interchange. I'm trying to remember as Ms. Ramona was sharing here in the last two items. Have we got a date? What was the date set? If there has been one yet? I know as we've been trying to make sure we can get this particular interchange done. And every time I go by there, it's like, wow, I can't believe it still looks like this, and things are happening, and traffic backed up, and all this, the things you see in that particular core of our city. So now, we know this got to be done. The gas line has to be removed or taken care of in order to move with the interchange work. But help me remember, what's the date? If there has been one set, if I can remember.
I don't know the date. I think we're 4 or 5 years out.
That's what I'm thinking. We're about 4 or 5 years out, even with this being done. Is that correct?
Yes.
Okay. Well, I think. Okay.
Yes.
We can check. There was a date, I believe, where there was some funding programmed in for future years for design and engineering, but we did not have any construction allocations.
Right.
We have, however, submitted even at the federal level, to try to advance that based upon, funding that may become available. In addition, we've been having frequent conversations with our local FDOT office.
Sure.
And as you stated, Commissioner Walker, you're exactly correct that, one of the things that we realized would need to happen would be the relocation of the gas line, so that should we come into some advanced funding, that wouldn't then be an obstacle. So it's tracking along in that way, but we can look to see if we can get a date as to when. I believe there was some funding in a future year programmed in to begin the engineering and design. So I can get that date for you.
Yeah, that's the reason why I asked that is because I remember sitting again as an alternate for Commissioner Birdsong, who sits on the Metropolitan MPO. Thank you. And that's been back in, I think this is August, back in May, I believe it was, and it was a priority. It was among the MPO listed as one of the priorities for us, and this being the last, of course, interchange in the I-4 corridor that desperately need to be updated. But I thought back then in May, I thought I saw something like a 26 year, fiscal year 26 or something, which is, right around the corner. That's why when I saw these dates here like it is, and AECOM doing what they got to do in 2 years, I'm thinking that's 23, so that's another 3 years out. And I see Chuck Barmy's here. Maybe he can share even more light to.
Run around looking for you.
But I think the public needs to hear and understand, because the public need to know that, hey, we're doing our part. But if you drive around that area on I-4,
doesn't look like it. Yeah.
It's like we ain't doing nothing. It looks ragged and battered and beat up, because truckers still having to come in and out. They got to get in and out to transverse and take the goods that they're having to get on I-4.
Good morning, everybody. For the record, Chuck Barmby with the Community and Economic Development Department, and Commissioner Walker has hit on certainly one of the top priorities for the city and the county over the past couple of years is Exit 38. The TPO's priorities do include construction funding as a kind of code number one priority, along with restoring projects that were deleted from the DOT work program during COVID. So it is still at the top of the priority list. Right-of-way is currently programmed through the year 2023. So there's still a couple more years worth of right-of-way acquisition to go. And so our request at this point is for construction to be funded at least in 2024. But there's no commitment at this point. DOT's official kind of position at this point is that construction would be programmed in 2028. So they're still many years out, which means that if we hold along that timeline and you assume a 3-year construction phase, we're 10 years out from actually the motorist seeing the benefit of an improved exit 38 interchange. And you go up the road to County Road 557, you can see what we should be seeing at State Road 33.
I agree.
This interchange hasn't been improved since it was constructed in 1964.
It's apparent.
And over the past 2 years, we've had about 4 million square feet of warehouse space that has been either constructed or in the process of being constructed in and around that interchange. And so we've done what we can to set aside funding in terms of impact fees to help match state funding to the tune of probably right around $2 million to help at least stabilize or keep the project moving forward. But this is one that is certainly, it's very frustrating to see the investments being made at other interchanges and not at this one. To address the current traffic operation issues at that interchange, the city is partnering with DOT to fund an interim signalization project that the city would be actually installing later this summer or this fall. So there will be signals for both the east and westbound ramps at exit 38 to at least provide some stopgap benefit until the ultimate interchange reconstruction project happens, whenever that does happen.
Well, I think it's important that, this kind of information and those who may be listening and our citizens understand, what we've been doing to make sure we can get this done. And then some of the roadblocks that may be that's hindering. And they just you have to get involved themselves as our citizens to make sure that area is growing. And it's growing every day. You look around, I think we get the new big, outside of the university campus, of course, to come out of the ground, and the innovation kind of work that's being done for that. But look at all the other things that are happening around, the manufacturing, all that's coming in that area. And like you just said, Mr. Bombay, you look just east of us, is major work being done, and there's nothing around it. I'm serious. I'm thinking nothing around it. But if you look just west, come back to us, all this growth, and we're just at a standstill.
So certainly the good thing about this particular resolution that we're passing is that
Yes.
it allows us to focus on infrastructure change that we need to make in order to expedite it, if it ever can be expedited.
And one bit of positive news, and this was late last week, the infrastructure bill that has passed the Senate and is waiting action by the House appears to include a $20 million set aside for this interchange. And so based on the listing that I saw Friday, it is tied for the highest funded improvement in the state, at least under that category. And so this was something that we had requested funding through Representative Franklin's office and other avenues. And so it looks like that there's 20 million that's in that infrastructure bill. We still need 45 million to fully fund the project, but certainly if the infrastructure bill passes and that 20 million's in there, I'm confident the state will find the rest of the money to make that interchange happen.
It's good news.
Yeah. Great. Commissioner McLeod and then Commissioner Reed.
Thank you, Mayor. Thank you, Chuck, for that update. That was going to be one of my questions about the federal infrastructure bill and what we were seeing right now. But on this item, on the relocation of the pipeline, do we expect major disruption to that area, to traffic during construction?
I believe, I'll leave that to our folks at Lakeland Electric.
Sure.
They would know more about that than I would.
Thank you.
Good morning, Commissioners. My name is Mike Dammer. I'm with Production Engineering at Lakeland Electric. Any roadway work in a utility will have inherent disruption. However, most of the engineering work that's going to go along with this task authorization is not going to impact traffic. This is solely the engineering study. When we come to you with the task authorization and the contract for the construction, we'll be able to talk more about what those disruptions will be.
Thank you.
Commissioner Reed.
Thank you. I'm glad you're up there. On the preceding number 2, if you go to page 35, where we have the area, where they have the map, can you pull up the preceding like number? This is number 3. We're on number 2. I'm trying to get. I'm not sure about the. I was having a question about the mapping of the transmission line. You see that red line? Is that the existing line, or is that proposed line? What is that?
Okay. Yes, so the red line that you would see from the Chastain-Seelman drawing, this is a blow up of that is one of the routes that we're currently looking at as part of a route study in order to determine the proper location for where we want to relocate the gas main to. We went through a route study where we evaluated 3 potential routes. Route 1 here, the red line, is our targeted route. It is the one that has come back right now. We haven't gotten the official final report from Chastain. When we do, we'll be looking at that and then moving forward officially with our design. That will actually be a second task authorization for AECom to begin design of the official relocation. Route 1 here will proceed north, following the 239 kV power line all the way up to I-4, and then following it along I-4, where we will tie back in at State Road 33. So that is our goal for the actual final relocation. This task authorization that's in front of you right now is solely for what we're calling spot relocations for a coexist strategy. That is, we are going to do minor relocations around what are targeted FDOT ponds, things in the vicinity of the interchange directly, so that we don't impact FDOT's construction schedule. Our actual build, the relocation, the official gas pipeline build, will move in concert with FDOT. These relocations, the coexist strategy, will be done so that we have time to build the entire gas pipeline.
I thought the pipeline was on the south side. Once you get over 33, isn't the gas line on the south side of I-4?
It's on the south side of the gas pipeline travels along what would be the north or west side of State Road 33's right-of-way. When it crosses underneath I-4, it would be on the west side of State Road 33, parallel to that. We then travel down to, that is Elite World Gymnasium on 33, where we make a turn south into the 239 kV right-of-way. Our goal is to make our tie at that location by Elite World and then proceed north along the 239 kV so we can avoid State Road 33 in its entirety.
That'll come underneath the big power lines all the way down going east?
It'll follow the power lines north, where the power line then turns to parallel I-4 along the south side of I-4. We'll continue to parallel that. At some point in time, close to the interchange, we will have to cross I-4, and then we proceed up Tom Cow Road to our yard in the Wellfield area.
Thank you.
Commissioner McCarley.
I just, no pun intended, but it's music to my ears when you say you're going to work in concert with FDOT and kind of be out of their way so it doesn't hinder their construction, since their construction seems to take a lot longer in their planning. So thank you. I'm glad Ellie is working diligently on that to make sure that all of our ducks are in a row prior to the breaking ground. And this pipeline, for people that don't know, this is what has made this, I think, a little more complicated and not as typical when we do interchanges and when we work. And also remembering for our public that I-4 and State Road 33 are both state roads. So it's not something that the city of Lakeland has purview over. However, we do have easements and we do have utilities that we have to work within to service our complete footprint in and around Lakeland. But thank you for being ahead of the curve with regard to that. And I think that Ellie's done a good job at planning ahead, so thanks.
Thank you.
Any other comments by commissioners? All right, any by the audience or questions? This is a voice vote. All those in favor signify by saying aye.
Aye.
Opposed, same. Unanimously passes. That ends the utility portion of the meeting, bringing us to audience for any comments. So if someone would like to make comments, just raise your hand and move to the podium. That would be great. We'll start with you, sir, and then we'll follow with you. Please just state your name and...
Father Paul Arms, 925 Murcott Street. You remember last time I brought up the issue of the Facebook page, which said that it's a myth that the side effects of the COVID-19 vaccine are dangerous, all right? And then I produced the stats by VAERS. Now, do you remember what VAERS is? The Vaccine Adverse Event Reporting System, okay? And so I mentioned that there were 1,887,507 adverse event reports as of that date 2 weeks ago, okay? I just looked yesterday at the newest report, and over the last 2 weeks, there have been added 72,193 events, which makes a total of 1,959,700 adverse events. So the City of Lakeland has on the Facebook page a statement by Johns Hopkins Medicine that that it's a myth that there are side effects that are dangerous, and they're saying that's a myth. When we've got VAERS, okay, now VAERS is put out by the U.S. government, and it is undergirded by the Center for Disease Control and the Food and Drug Administration. And so we have Johns Hopkins in conflict with VAERS and the Center for Disease Control and the FDA. So who's telling the truth? I'm confused. So, city commissioners, you're publishing data that's quite in disagreement with VAERS, all right? And so I'm confused. Who should I believe? And should I take the risk of getting a biological experimental substance, which is really the proper demarcation for the vaccine, because it's not officially a vaccine, it's just an experimental substance, legally speaking. And so, therefore, should I take the risk or not? So, city commissioners, you're behind that statement. Is that what you're saying? No comment. I would wonder if, where is the truth? I believe God's truth. So which side is God on? Is God on Johns Hopkins or is he on VAERS? Now, let's put it this way. I've studied vaccines for many years. I know that the vaccine manufacturers expect an adverse reaction of at least 2 to 3%. And so they still do it, and they know people are going to be injured, but it's survival of the fittest. You know, it's too bad for those that are gene affected. They have bad genes. But we expect some people to get damaged. But nevertheless, we move forward because it's for the benefit of the majority. That's nice evolutionary thinking, which I totally disagree with. I think the Lord disagrees with it too. We don't put people up to experiments like that. And so therefore, I just need to know, why is this thing still being published? And Mr. Mayor, you said in one email, you said, but your continuing voices need to overpower the fewer that resist, who resist. So in an email that you sent to someone in the commission, you're saying continue to voice over against those who are resisting. So is this a campaign to continue to overvoice those who are resisting? Your resistance is saying that there's just about 2 million adverse reactions. And as a matter of fact, there's a lawsuit in Honolulu, in Hawaii right now, where they're saying that 45,000 people have died from the vaccine. VAERS is saying 4,900. But remember, that's 1%, they say, of the actual occurrences. So you have a lawsuit now in Hawaii saying that there are 45,000 deaths. And yet you still have on Facebook that there's no bad reactions. I'd fear God. I'd be a little bit worried about that myself. I want to have people, I want to protect my people in my community. And I think you need to continue to do due diligence. Thank you.
Thank you. And I want you to know we do.
I disagree. That's why I'm here.
We're continuing to make sure we...
You will do due diligence when you straighten out the vocabulary and get on the right track with the effects of what's going on in this country. So I don't think you're doing it.
Okay. Thank you, sir.
Mr. Mayor?
Yes, sir.
If I may, to the commission, because it's not really your purview on a daily basis to determine what we do or do not post on the city's social media page. That is through our communication department and certainly falls under my responsibility. I just want to assure that the commission that what we are presently doing and have been doing since some time, especially during the spike, is coordinating with our local healthcare providers, many of whom you heard from this morning, from the health department, from Daniel Drummond at Lakeland Regional, and also from Dr. Ackinger. And so we're not posting anything that hasn't been in coordination with, and in some cases by request of, our local healthcare provider. So I just want to make sure that the commission is aware we're not creating content. We're just basically regurgitating from those healthcare providers that I've mentioned. Thank you.
Thank you.
And I would add, if we have a slide that says it's a myth that the vaccine is dangerous, that's probably a phrase we shouldn't have on our site, because we don't necessarily know that it doesn't have some ramifications with some people. We don't have to weigh in that phrase, to your point. And what we can provide is data, you know, and the information that they do give us. So appreciate your comments.
I have a question. On our social media, do we have a spot in there for comments from the citizens to address us? Okay. Yeah. I hardly ever look at it, but I read it a lot when we're at events, but I haven't seen this particular part. I just, so I guess you could make comments on that spot if you wished.
All right, thank you. Appreciate those comments. Anyone else? Yes, sir.
My name is Billy Dilvines, 85 Lucille Street, live in Spurley Mobile Home Park. I call it a glorified mobile home park because these trailers that we living in as seniors and disabled, we bought a place unsafe. We did not know it had termites. We did not know the floors were not that good. I have a 78-year-old wife. She has issues. I asked the, there's supposed to be a place where you can get help with remodeling the place, the government. Yeah, they did. They took out the heat. They turned around, put a recirculation air vent in the house. Only thing we got is window airs and a little heater in the front room. I haven't been in that bedroom since we first moved here. But I talked to the people and they said, due to my income and they can't do anything about it. I'm asking for a senior disabled, why can't the city or somebody govern these trailer parks? The lot rent's $441 a month, and we just barely making his meat. I'm looking for a hands up, not a hands out. Like I went to Alfie. They had on Main Street at a church where you go get your help for your electric. I put my application in. I got a letter from them says they can't help me because I'm making too much income. Can you live on $1,211 a month? I do. Can you pay for dependables like medical, durable goods? You can't, but I do. Can you feed your family and you ask for charity and try to get a hands up? It's hard. A lot of our homeless in our community, we had a deaf woman over in the Save-A-Lot in front of me. She got kicked off the property because a lot of people don't understand about deaf and hearing impaired. And the seniors and disabled. I'm standing up right now for the low income. I don't care what race, color, region, or nationality. It's not that issue. It's the way we have our lives. I came from a state where when winterization, the heatness, when they came in, they put windows in. They fixed it for where the client could have somewhere a decent place to live. What happened to a decent place to live when you buy a place? I had to buy the place on site scene because I had to bring my wife to a better hospital. Thank God for Watson Clinic. I'm seizure free. I have issues, medical issues, but my wife has come first. My family. All I'm asking, hands up, not a hands out from the city. Somewhere we can lay our heads. I don't like to be in the house, and I've been there. I obey by the rules, because if on the top, my wife has issues where, you know, when you get senior and things, issues, she turns around. We have to have our TV up. It may bother the neighbors, but our neighbors are good. But I'm talking about, these landlords owns these trailer parks keep rising the rent, knowing there's a lot of people out there. Yes, there's a lot of people out there having the money. But there's a lot of your seniors are living in them trailer parks, living closed door, living day in and day out, not going nowhere, not doing things because of this disease. What I'm here about is asking for a hands up, not a hands out, for just not for me, for seniors and disabled who go below the poverty level. People who don't have much. People move their families here for a better life, better home. I'm born and raised in Tampa. But I believe trying to help one another. I do street ministry, but I had to cut that back a lot to help my wife, 77 years old. We just need help, a hands up. And thanks to our councilman that's in our district, I'm glad I'm in the city. This is my first time here. I've been in city council's meetings in Cross City. There's a lot change. But my opinion, for this city, we need to help our seniors and disabled who's below the poverty level get more help. Get on to Alfie to help with people with runways, you know, the heating assist. I'm asking for summer schooling. That's why I went to help. But when you get denied from a government, you know, they're saying you're making too much income. How? When your lot rent's $441 a month, your car payment's almost $250 to $300 a month. Your insurance, because I had too many wrecks, it's going up to almost $300 a month. And I have to pay that to keep transportation going for my wife, to take it to and from. We have home health. They come in twice a week, physical therapy, nurse. We have Vista come in and help with the bathing and things for my wife. I appreciate them. I appreciate the government. But what I'm here today is just for asking a hands up. Somewhere we can relocate, or somebody to help us find a better home for my wife. I don't care about myself. When you love somebody, you don't care. You try to help for the others. I left her home by herself today just to come here. And I'm worried about her when I'm sitting down there, because she is mostly in her chair constantly. She's on a walker. I put on what they call GoFundMe. I never get a response from them, because everybody thinks we live in a trailer glorified mobile home park. We're making too much. That's not necessary. There's a guy across the street, his father's homebound, income level low. There's a lot of your seniors. You guys look at these trailer parks. Find out why they're selling these older trailers in these parks, and not make sure the realtors are responsible for that trailer. Make sure it's safe for the seniors.
Thank you, sir. We appreciate your comment.
I went along with it. Thank you.
Thank you.
Just please help.
Yes.
Hang around. Let me give you a business card after the meeting is over, and I'll see if I can get you in touch with a couple of organizations and see if we can help.
Lighthouse Ministry helped us with food and stuff. Vista helped us with food.
Yeah, and there's tons and tons of them, and I'm on a subcommittee that does some things. So let me just see if there's some names that we can connect back and forth and just see how we can help.
I would like to own my own property with land and all, not in a trailer park.
Okay. Yeah, and this is more towards you personally than, say, the land or the house or things like that. But just hang around outside, and I'll get you some information.
Thank you very much. Thank you, Mayor, because this is a good city. That's why I came here. The hospital and people and families. But we need to do better for our seniors.
Well, you coming here and making these things known is what gives us the direction to continue to help. So thank you.
I told my wife this morning, she's so afraid of me leaving her that she said, "Billy, where are you?" I'm there for a long haul. I'm 58 years old. I married a 78-year-old wife. She took care of me for my epilepsy. Back then, I worked at University Community Hospital, for 5 jobs. But when it comes family, and I do street ministry, and my first thing is the family and God. This gentleman here, his beliefs about the disease, we're there. We're in Revelation. But what I'm talking about is people need hands up, not hands out.
Okay. Well, hang around and I'll get you some information.
Thank you.
Mr. Walker.
Thank you.
Sir, thank you, Mr. Mayor. This is a gentleman that I was talking about when I shared with him, about particular situations and needs, of course, that he has, and I would agree with you, sir. But I don't know what Commissioner Music may share with you, and I'm sure he will share with you what various organizations are there. But certainly we have a plethora of organizations in our city that reach out to our seniors and help support. And one guiding source, and I found to be very supportive, is our Age Friendly Lakeland organization. And I don't know if you've been in contact with them. I don't know if you was going to even share that with them, Commissioner.
Some of these organizations, they want to be 60 and over. I married an older woman.
You got someone in your home that's 60 and over, so that's support right there they would give you, sir. So I think, as he mentioned, Commissioner Music has mentioned, get with you to share with you maybe some.
If it works for me, I pass it on. That's what I do.
Yeah.
Those that really can help and be a support, how you could, get in contact and hopefully be supportive to help you with your needs, okay?
Right, this is my first time here, and I do appreciate the councilman, and I've been watching you guys online. I do appreciate what you go through, and the city is growing, but I had to bring up the senior issue, because I'm at my wit. I even called Channel 8 News, 8 on your side. They never did call me back, because they think I'm a kook.
Well, we've got some great social services and some great individuals here that have a love and a heart for the people in your position. So just get with me afterwards, and we'll do all we can to connect. Thank you.
I appreciate it. Thank you.
Appreciate your time.
Thank you, Mayor.
Thank you,
and
Commissioner
Council.
Music, on that. Anyone else? Yes, sir. Please state your name, sir.
Jonathan Freed, thank you for the opportunity for just a moment. Some of this is somewhat of a moot point, given the discussions with Dr. Jackson and Danielle Drummond a little earlier. I can understand that public comment along with that topic. You could be here for 7 years, and maybe by then COVID would be behind us. But just a couple things that related to that. Presently, Watson Clinic, I know you guys don't oversee Watson Clinic private industry, but they do make an impact as to the decisions that the Lakeland community might make. They're a very large influence in our area. Their decision to get vaxxed by November 1 or get fired, basically, is a very big topic of discussion around the area. I'm sure Dr. Drummond with Lakeland Health is, that was brought up. It's under discussion, but no decision being made. I'm not sure what kind of influence this commission has with that type of decision. I would suggest a connection with this. The question was concerning staffing and personnel resources at Lakeland Health. You might have a lot of available staff after Watson Clinic makes its final decision, but that would only become a benefit to Lakeland Health if it makes an opposite decision, which I would hope it does. I heard a couple comments by the commission today about nonpartisan, stay neutral with certain things, being careful of the rhetoric or of the position that it takes on certain types of decisions. And so if that be the case, I hope it actually truly stays neutral, provide honest and honest information that's out there, and not sway an opinion as to which way people should make their decision. Personally, I'm opposed. It doesn't bother me if somebody wants to get a vaccine. That's personally their decision. It's also personally their decision if they don't want to get a vaccine. And so I hope that the city doesn't engage in pressure tactics. I know it would tend to stay away from pressure tactics towards the citizenry. However, there is a message that is transferred when it does pressure tactics towards its employees. So I hope that it would stay away from that as well. That's really about, well, let me check my notes real quick. I wanted to ask the question as well, again, maybe a moot point given at the end and the doctors are no longer here to speak towards this, but coupling recovered patients along with vaccinated persons. Where do we stand concerning herd immunity in our area? So you have recovered patients and then vaccinated persons as well. So where do those numbers fall? And as far as Lakeland, Polk County region getting into a close, safe zone. So that would have been a question for them, but maybe I'll send an email.
Yeah, I think the answer to that probably is once there is a strong decline with respect to this current surge, that's where we're going to, if that's what I'm understanding what you're asking, that's when we get back under 10%. That's where they can relax more in terms of positive daily tests on COVID.
Yeah, I think the curve number might relate to the current cases more so than herd immunity. I'm not a doctor, I'm not a scientist. I don't necessarily, I don't even care for the rhetoric of believe the science. I would tend to fall under your category, sir. I'm going to believe God rather than believe science. But I think science eventually comes out to prove that God was true all along. But you know, do we need to reach 50%, 60%, 70% of the community either having recovered or been vaccinated when we reach that area of herd immunity?
And of course, this is still speculation, but in the medical community, the combination of herd and vaccination in the 80 percentile is where it starts to fall.
80 percentile? Yeah. Okay. All right. Awesome. Thank you.
Thank you for coming.
Thank you.
Sure. Go ahead. We're just free as can be today and nonpartisan.
There was just a doctor who spoke at Mount Vernon school board, and I guess that's Virginia, and he made a very good point. He said that you cannot eradicate totally COVID because it's reservoired in animals. You know, and so therefore, it's a myth that you can just totally get rid of it. It's reservoired. And so the idea is, he said, is that in the summer where vitamin D is strong, you shouldn't be getting it. Why are people getting it? Because of vaccines. That's my opinion. But I wanted to say it's a myth to just you think you're going to eradicate the whole thing. It's not going to happen. It's always with us.
Just look what happened with polio.
Well, you know, I know a story of a man who changed his baby's diaper who got the polio vaccine and he died from polio because it transmitted. Yeah, I know. And Dr. Salk said that the largest reason for polio now was his vaccine. It was, you know, the live viruses and things like that. So anyway, so the whole vaccine theory has a lot of still nebulous stuff in it. And so plagues run their courses too. And so they don't fully know a lot of things. That's why it's dangerous to legislate.
Well, we live in a state, I think that's not probable that we'll be legislating. Any other comments from any other citizens? All right, commissioner comments. Anything to wrap up? Commissioner McLeod.
Thank you, Mayor. Well, as has been said, congratulations to Commissioner Walker for assuming the presidency of Florida League of Cities. I think we're all behind you and proud of you for that honor and excited to watch you lead FLC over the next year. I'm just dipping my toe into the world of FLC being on a policy committee, but certainly wanted to congratulate you on that. And then National Night Out, I didn't get a chance at our last budget meeting when I was calling in, just to say how much I appreciate LPD and everybody who was part of National Night Out. It was my first experience and thoroughly enjoyed just going out into the community and seeing the appreciation for our men and women in law enforcement and also chatting with residents. I know I had a chance to have people bend my ear about a number of topics and it was fun, and I'm sure my colleagues did as well. So just thank you to the police department for all the work that went into that, and can't wait to do it again next year.
Great, thank you. Other comments? Commissioner Madden.
Well, since we're on the FLC, that was my comments for today as well. It's always a joy to be able to be a cheerleader for Commissioner Walker. He did a great job. He had his family there. He gave an inspirational speech to everyone who was attending. And so it was just a pleasure for me to go and be the delegate. I do want to also just say that for my colleagues and for city managers and other folks in city government, it's always a source of education and inspiration. Of course, the 4-hour ethics course might not be as inspirational, but always full of reminders about the Sunshine Law and our duties as local electeds. We talked about the nonpartisan nature. That is a unique thing that we have, and we have to be cautious with that. We have to be cautious that we can't talk outside of these meetings and try to convince each other. We have to talk about it all here. And so, that is always just a good reminder every year that we are, your electeds, take seriously. And that's a requirement to do that 4-hour ethics course. Certainly, there are all kinds of sessions that you can sign up for, the American Rescue Plan dollars. If you need help with legal in your city, or if you're looking for best practices on communication, there are just a plethora of things you can sign up for. I don't think you'd be surprised on what my favorite topics are, because they are always about innovation. So I loved hearing about, looking at that infrastructure package, however it may come, particularly the bipartisan one. With regard to EV charging stations, we have Lakeland Electric, and so we see that as a customer to have more EV adoption. And also to think about with regards to transportation. And we just talked about how expensive the millions of dollars for that 33 interchange, and I think I was exasperated at the last meeting, just, thinking when we get the funding for Wabash and those things. So 2 really cool things. One is microtransit. It is an autonomous vehicle. You may have heard of it. Beep is the company. They started in 2019 and went through the pandemic, and 2 years later already have 23 shuttles in 8 locations. They've just finished a pilot in Yellowstone National Park, so people are riding these 8-passenger autonomous shuttles throughout the park, and they're collecting data. And Lake Noaa, which is a shining star in Florida for innovation. I think that we should look into them, because that's kind of how I envision the innovation district around Florida Poly. They are going to have 8 shuttles and 5 routes with those Beep 8-passenger autonomous shuttles going around. And the big deal for Beep, unlike a lot of autonomous vehicle testing, is highway miles. Highway miles is kind of the low-hanging fruit, putting freight, because you don't have stoplights and pedestrians and bikes like you do inside a small town. So basically, putting it in a small town environment is the most complex environment. So their goal is to have these shuttles and their data collectors. And so all the while they're offering the microtransit, they're also collecting data so that they can create sensors and software and things like that they could actually sell to other manufacturers of autonomous vehicles. So really cool company to keep our eye on. And the other one is electric aviation. And so super cool, like the Jetsons cool. Lilium is the company, and they're a German company, and they have 150 and 175 mile an hour piloted 6-person, so 6 passengers plus a pilot. They're going to keep pilots first, because they don't feel like people have enough trust level, with not a piloted. But it is, it has this vertical shut up, and then, has to have some space for like regional to go to like Miami to Tampa, or Tampa to Jacksonville. So they are really seeing that this regional approach, it's going to fall underneath the helicopter and small jet FAA rules for now, but certainly they are silent because they are electric, and they can land on a parking garage, which the options, can you imagine flying in from around the globe to Orlando and getting on a vertiport and then going over to any beach in Florida for $150 and just landing on the parking lot and going out to the beach with your lawn chairs and coolers. So really exciting technology in the works. And the great thing about both of these is that, well, this one in particular, you don't have to create a highway. You don't have to build a highway to get from point A to point B. And even your infrastructure costs with this vertiport on top of a parking lot, how it lands is just minimal. They anticipate public-private partnerships. So to get private sector, wanting to give them a landing spot. So those are just really two, when you get so overwhelmed, with the trajectory of growth. And that's my final thought, was the demographer, who was one of the main speakers. The trajectory of growth that we are anticipating, honestly, I know people would like us to build a wall around the city, and I think that's what we'd have to do to be able to stop the growth that's projected, which can be scary, for people to think we don't have enough money to build enough roads, to build enough houses, maybe for this upcoming growth. But to think about the growth, what are the numbers? The demographer is all about the numbers. He sees exponential growth in our senior population. Cool to think that we think we know seniors because of our current seniors, but the greatest generation being the smallest generation. The boomers coming up as seniors, they are not expecting to die. They will have the best health care on the planet. They don't want to wait in lines. They've been large and in charge for a long, long time. And, and there are more of them than the Gen Xers. And so they, are going to be a force to be reckoned with as they fill our state. But not to be overshadowed by those millennials, 88 million of them, who, if you're a bigot, you better get over it, because they believe in diversity and they love it, and they believe in clean energy. And it was funny how he said, we've been kind of this conservative red wave was really because of the liberal 60s, smoke, drugs, sex, and rock and roll. They all grew up and amassed money, and now they don't want to share. I thought he was being humorous, because I think he was a Republican himself. And has moved to Florida. But he said, he said this new group of millennials, we cannot ignore, what is on their hearts and minds. And, so I'm excited that they do like, clean energy, because I do think EV and autonomous vehicles and stuff like that is really cool. So all of that was just fun to kind of make fun of ourselves, no matter what side you fall in the political spectrum, for the demographer. And really exciting to kind of think about maybe there are some solutions just around the corner, and how cool is it that we annex land to have the state's only STEM school, and we have Florida Poly right there in the middle of farmland, to dream about possibilities and innovation and change the trajectory of transportation.
Excellent.
Mayor, may I ask a question?
Yeah, Commissioner McLeod, sure.
On the autonomous vehicles and the jets and shuttles, how are they funding that?
Well, it's a private company.
It's okay.
Yes. So, and it's a German company, and they are looking right now for private partners and cities. So if they can get an industry user in a city, and that, so Lake Noaa is their first vertiport.
So you think about Yellowstone's a perfect place for them. Fixed routes, fixed stops,
right.
People having a vacation experience, and they're getting data all the time. And Lake Noaa is a fixed set of stops. And so those kinds of things that you can then release drivers from and build information on become great. The Veriport and the Lillian is riskier. And so I'm glad they have pilots in them.
Right.
Because, that fallout.
You don't have to travel far to see this German company's first vertiport in the country is right there in our backyard. So that's exciting.
But you take a vertiport, for example, could be the city garage, Main Street garage. You could land in the center downtown.
Exactly.
And take the top floor of that just to make that the spot that it lands.
Don't lose the parking, we already have a small.
We're working on that too. Yeah, Commissioner McCarley.
I'm glad that both of these have been brought up. I want to congratulate Commissioner Walker again. I know we all echo our admiration for him. He's been such an active participant in Florida League and Ridge League of Cities here locally for so many years, and we really appreciate you representing Lakeland so well and all of us so well. But on the note of transportation, I just wanted to say congratulations to Central Florida Aerospace Academy. We were all there, I guess, week before last on the opening of Skylab, which is really amazing. It's one of the only education facilities in the country that is grooming those next generation of pilots and mechanics and giving our talent here locally opportunities to serve in the airline industry and engineering. And so we love what they do out there. It's amazing. Sun and Fun helps fund that. So it is a wonderful public-private partnership with the school district, and we got to see the new superintendent out there, and he is so far holding his own and doing well, and we are a very big county with a lot of students, so having Central Florida Aerospace as part of that puzzle and education for us, I think is really great. So congratulations to them. The second announcement I want to make is the 2021, so on topic, Transportation Summit will be Thursday, September 9th. That will be at the Field House in Winter Haven, the Advent Field House, and that is a discussion from 9 until 3:30 in the afternoon about transportation needs across Polk County. So it brings together all of our partners, municipal partners, Transportation Planning Organization, which we all sit on that as representatives of our different 17 municipalities in Polk County, as well as our planners. It's usually a really good place to learn about the long-term vision and what the demographics that Commissioner Madden just brought up, what that's going to look like for our area. We have Central Florida Regional Planning as a partner in that Transportation Summit. They typically bring in a speaker and discuss what it's going to look like on the I-4 corridor and south, which is the areas we serve. So I don't know if there'll be private industry there talking about other transportation shifts. That would be exciting, but it'll be very interesting. I've attended these even prior to sitting on the commission, and it's an interesting day. It's free to the public, so you can find that. I'm trying to think of the best website. Maybe we can have that on some city commission social media. But it's September 9th at the Advent Field House in Winter Haven from 9 until 3:30 p.m. And the last thing that I wanted to bring up is just as a reminder for the public. Each of us, we're trying to be more cognizant of sharing the different entities that we serve on as your city commissioner. So we have different assignments, whether it's Polk Regional Water Co-op or Transportation Planning Organization, or I am on Citrus Connection as the mayor and Commissioner Walker. We do a lot of different things. One of my appointments is Lakeland Vision, and just so people will know that we're continuing to dialogue, Lakeland Vision is a nonpartisan, non-governmental entity. It's a nonprofit agency here in Lakeland. So what the citizens want and need, and tries to reflect back to different anchor institutions what those needs are. And one of our newer committees that bubbled up since last summer is Community Unity. So we have a group that looks at Lift Lakeland, which the mayor had brought to the forefront for us last summer. And I have a small committee meeting coming up this week, as well as an education meeting in 2 weeks. So just to let you know, those are some of the downtime things we do in serving the residents of Lakeland and the community at large. But lots of people care about Lakeland, and we get to see that on a regular basis. And so that's what makes Lakeland great. Thanks.
Thank you. Commissioner Music, anything?
I'm good.
Commissioner Walker, any final thoughts?
Finally, I just want to let you all know, I think sometimes, not so much we, but our community as a whole, I think forget about the jewel we have here in Lakeland. And the things that I know I've heard for years, and the kind of accolades we get, from other cities when we're outside of our own area, hearing about the different things that we do so well, and staff, being the ones that make it happen. Yeah. We hear so much about Lakeland and how Lakeland is, the place to be almost. And even the comment that came from our citizen here this morning, the gentleman, even though he needs and have needs of support, but he came to Lakeland because he knew Lakeland was a place where he could settle, and he and his spouse, his wife, and be able to have certain situations taken care of. That's important. And I hear it all the time, in my service and serving time with Florida cities, how Lakeland has always looked at being the ones you can use them as an example, for different things that we have done. And I'll conclude by saying, for those that did not know, and for you all as my family here to know, the four major, I guess I will call, take-homes that we'll be dealing with through FLC as a state organization to support all the different 411 city, towns, and villages are, especially those that don't have the resources and staff that we have here in Lakeland. We're blessed, but there are many small municipalities that don't have these resources and the staff to be of support. So FLC provides it for them, and now with the dollars that are coming from, billions of dollars that are coming into our hands for to support things that happen as a result of COVID, and the American Rescue Plan being there to support us. Well, FLC is going to provide those kind of, resources and hands-on situations to help those city, towns, and villages that don't have it, like we have it, and some examples. So that's one. Secondly, we still, as I think Commissioner Madden has already shared, we're doing as best we can to continue our grassroots advocacy effort, especially when it comes to education and being able to have our citizenry informed, especially our citizenry informed, because if our citizens are informed, they can come and be able to pretty much an army for us to use to get the things that we need to happen, like this State Road 38 situation. State Road 33, exit 38, excuse me. Thank you, sis. That we need to make sure it gets done and have happen in our community. Third thing is we still, as you heard, Commissioner Madden even mentioned again about the speaker and spoke about how Florida is changing. We're working on, making sure that those towns or cities or villages don't have the resources again about how to have that talk, and share when it comes to diversity and inclusion. Sometimes it's a tough talk to make happen. Well, we're going to be able to help you to have that talk, that conversation, that shared conversation about it, and how you can make sure we can make it happen for all of us here, because our state is changing, changing drastically. And you looked at some of those percentages that this particular speaker shared with us, it's changing fast. And lastly, of course, this year in my presidency of FLC, we'll be celebrating 100 years. 100 years this organization has been around, doing what it's due to help support and protect, of course, as best they can, the things that our cities, towns, and villages need and don't want to have happen as far as preemptions and those kind of things that come about. So 100 years of celebration, and looking forward to how we can help different things come about for the celebration time. All right? Thank you, Mr. Mayor.
Thank you. Is there any other matters you want to bring up at this point? If not, we are adjourned. Thank you. Let's do this thing.